Morning.
Oh, well, that's on the clinic. Everybody gets to speak then.
Oh, comment too. If that's on the clinic hearing, you close it on comment.
They close the public comment. No, I can keep them here.
It's if you guys want to reopen. I think it's a legislative action. It makes any difference if you want to reopen. Okay. It's up to you guys.
Yes. Turn it into. Oh, there you go.
Just the lady there. Yeah, I got yours.
I'm giving you.
Supervisor, good to see you, sir.
Does your mom's cafe still there? They used to be really good eating place. I worked there for a number of years.
I give statements to you.
What's that? The Mexican restaurant across the street from the fire station on Tulare. The chef there is actually trained at. Oh, okay.
Oh, okay.
Excuse me.
It's like
You get out there and get the chairman, you get to see him.
under that. From on the closed session.
Oh. I want to read up on it.
This is the employee.
Read.
We have to do asthma day first.
Is that D?
Yeah.
D. Okay.
I forgot to ask you. Thank you.
We said, why are we doing the first one? We got all this other good flaws, what I'm saying. Could you just find that out for me? All right, on that happy note,
I get my hair in case it frees up on us.
would it be Stephanie, and is she here?
Where do we stand?
Good morning. How like me to be chronologically challenged. Something I often remark about. Good morning. Welcome to the April 17th, 2007 meeting of the Tulare County Board of Supervisors. Please join the board and I as we salute the flag and then remain standing for a moment of silence. I think we would all like to remember the victims of the tragedy in Virginia during our moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. As we begin the agenda this morning, I would like to take up first an item that is not on the agenda. That doesn't mean it's not important and not special to this board. So I would like to turn it to you, Mr. Haddix, for the first item I'd like to take up this morning.
Thank you, Chairman. I would like to recognize the new Assistant County Administrative Officer for Finance, Mike Spada, who has joined the county team, but more importantly, rejoined the county team. Mike comes to us as formerly with County Council, and then after that he had been the city attorney in the city of Lathrop, and then for a period the city manager of the city of Lathrop. He brings as a strength to the team here not only his excellence in knowledge and working base and having his home here in Visalia, but also he has a master's in public administration, a master's of business administration, and I'd like to say that Mike is such a bright member of our team that when we stand in his presence we have to wear dark glasses. He's so bright. And so with that, Mr. Spada.
Thank you, Brian. You're very kind. Can you hear me now? Chair Conway, members of the board, I can't tell you how delighted I am and happy I am to be here to return to Tulare County. I look forward to working with your board, with the CAO, with County Council, and other agencies and departments as we all work together on the many public policy and fiscal issues facing your county. This is a terrific board. It is, again, a pleasure to be back to work with the good people of Tulare County. Thank you.
Thank you, Mr. Spada. It's so good to have you back. Comments from any other members of the board or questions for Mr. Spada on his second day of work?
Sure, if I might, I just want to say welcome home. And it's really when first Brian told us that you might be interested in coming back to Tulare County, I can tell you the response of every person I saw was one of pure delight. And we're just very, very grateful that you decided to keep your home here in Visalia, Mike, and that things worked out the way they did. You know us, we know you, and sometimes that's not the case with new employment and new employees. And so we're just really happy that you're here and look forward to working with you in a different kind of capacity. Although we might ask you a few legal questions. But welcome home.
Yeah, just remember that caveat that goes with every job description and all other duties as assigned.
I can't forget it.
Madam Chair, I just want to know if we're going to get the plaque back we gave him when
It's on its way.
Good
You
order.
would think of that, Mr. Cox.
And thank you once again, Mr. Spada. As I say, your talents are many, and we're happy to see you back. I, missed you in many respects for land use issues that you and I used to discuss on a frequent basis, and it looks like we'll be talking about other things in the future, but very excited and happy that you're back with Tulare County.
Thank you very much. The feeling is mutual.
Okay, we will then move to item number 1 on our agenda, which is the board has a proclamation declaring Tuesday, May 1st, 2007 as World Asthma Day in Tulare County. Is Stephanie Mullen here? She is. Great. Well, then it's my pleasure. County Board of Supervisors proclamation.
Connie, you're being recorded.
Do I need that? I'm not projecting. Declaring May 1st, 2007 World Asthma Day in Tulare County. Whereas asthma is a chronic inflammatory disease in which the airways of the lungs constrict and swell, causing wheezing, breathlessness, chest tightness, and coughing. And whereas asthma has reached epidemic portions in California, affecting 1 in 6 children under the age of 18. And whereas asthma is the leading cause, we need to correct that, don't we? The leading cause of childhood hospitalizations, chronic illness, full absenteeism of more than 14 million missed school days nationally, and 232% increased disability due to asthma over the past 3 decades. And whereas exposure to allergens, irritants, and environmental triggers such as dust mites, mold, pollen, cockroaches, pet dander, environmental tobacco smoke, and poor air quality can exacerbate asthma. I didn't say that correctly. Whereas National Observance of World Asthma Day offers an opportunity to educate our community about ways to control asthma, ensure every person with asthma is properly diagnosed and receives appropriate treatment, and families in our community learn how to effectively control environmental triggers of asthma. And whereas the County of Tulare recognizes the Tulare County Asthma Coalition for their efforts, past and present, to fight asthma and raise asthma awareness throughout the community, now therefore be it resolved that the Tulare County Board of Supervisors do hereby declare May 1st, 2007 as World Asthma Day in this community, and encourages all citizens to become aware of the risks asthma presents and participate in asthma awareness programs. Signed, Alan Ishida, Chairman, Supervisor Conway, Supervisor Cox, Supervisor Worthley, and Supervisor Innes. I'd like to present this to you, the board and the county, and feel free to address us if you like.
The Tulare County Asthma Coalition really appreciates the recognition of World Asthma Day from the Board of Supervisors. We do work hard throughout the year to raise funds and provide asthmatics with the tools they need and the education that they need to better control and take care of their asthma. We will be having an event in Tulare at the Oak Bayou Soccer Field on May 5th from 9 to 12, and it will be asthma awareness and a walk and a fair with booths and education materials and games and prizes for all ages. Thank you.
Thank you very much. I know I have at least one board member who suffers from asthma, or so he tells me. So,
A grandson also.
okay. Supervisor Cox, we look for your leadership in this area. Okay, we have a 9:30 timed item, and I don't want to get ahead of myself, but I'm really anxious to do this. But I won't. I think I'm under orders from staff that I'm to wait till 9:30. So then in that case, I would like to move to the consent calendar. Any items that need to be pulled, or any corrections and additions?
If there are none, Madam Chairman, I would move approval of the consent calendar items 6 through 24.
Second.
Cast your votes, please. Okay.
You want to report out so they hear it on the microphone?
Oh, yes, this is new. I forgot about that. Okay. Consent calendar passes unanimous vote. Gosh, I'm not going to sing and dance. Everybody will leave. I guess we can move to our untimed items. Item 25, request from Resource Management Agency.
Good morning, Board. Brett Fussell, Assistant Director with the Resource Management Agency. The item before you this morning is a request from your agency staff to approve the second amendment to the Dockin agreement for the Road 80 widening project, adding in the task of preparing the plans, specifications, and estimate, and the acquisition of right-of-way. You'll recall back in December of last year, the CTC allocated approximately $16.7 million for the second phase of this project, which allows us then to prepare the necessary documents and acquire the right-of-way in order to proceed to construction. The original agreement that we executed with Dockin Engineering allowed for us to move into this task without having to go through a additional RFP process. We were very satisfied with Dockin's work in preparing the environmental document and the preliminary engineering. So we then worked with them to develop the scope of work and fee for service to then prepare the PS&E and acquire right-of-way. So we're really excited to move on to this phase of the project, and our plan is within 2 years, get an allocation from the CTC to then proceed to construction of a substantial portion of the project between Visalia and the city of Dinuba. With that, I'll respond to any questions that the board may have.
Questions from board members?
The question I have, Britt, is that based upon our action here today, when would they begin the right-of-way acquisition process?
The first step that we're going to take after you approve this amendment is to have a kickoff meeting with the consultant and all of his sub-consultants, one of which is the right-of-way acquisition sub-consultant. And from that, we will establish a schedule. One thing that we have impressed upon the consultant, the need to proceed with this project in a timely manner. That acquisition of right-of-way is critical to being able to meet that timely manner, because what we'd like to do is hopefully be able to start construction on a phase of this project within a year to 15 months rather than at the end of 2 years. So at that point in time, we will ask the consultant to give us a schedule and to identify where they think they could begin work first and get that project done.
So without giving us as soon as possible, meaning probably within the next 2 months, we would expect? Or?
Yeah, the first task that they were going to have to do is order title reports so they can understand the ownership and the interest in the parcels, and then get the appraiser to work to begin appraising the properties to determine the fair market value for acquisition. And our intent would be for them to start work on that task the Monday after we meet with our kickoff meeting, which we're hoping the meeting will be a week from Friday on April 27th. We intend to pursue this project aggressively. And the consultant has been...
Those are good words to the supervisor,
right.
that was told this project would be completed by now. So, it's, I mean,
right.
and it's no fault of the county, but I mean, it's just taken a lot longer than we all
right.
hoped it would take, but very pleased that we were able to make this progress to this point and get, not have to go out to an RFP. I'm sure that saved us a considerable amount of time, so thank you.
Yeah, we're looking forward to getting this phase started. The engineering staff is looking forward to actually doing some engineering rather than just dealing with environmental aspects of the project.
If I may, you're looking at the entire, I know this is set up for 3 phases of construction.
That's correct.
But is this task they're performing for the entire length from Visalia?
Yes, they will be designing the entire project between Goshen Avenue in Visalia to El Monte Way or Avenue 416 in Dinuba.
All the planning, all that will be done?
Yes.
The right-of-way acquisition, is that
Yes.
all 3 sections
Yes.
as well?
Yes.
And in which order is the construction? Is it the north side first, south side first? Are they going to be done at the same time?
We actually are trying to be flexible in that regard so that we can deliver the project that we can acquire right away and move on quickly. Our initial thoughts would be to start at the south and do the Visalia segment, then jump to the north, do the segment that's in Dinuba, and then as a third phase of the project, we would close the gap between the two. Somewhere probably in the second phase, we will be doing the structures across the rivers and creeks we have to cross, so that when we get to the third phase to close the gap, we don't have to worry about structures interrupting timing of the project, because the structures will need to be constructed while the channels are dry in order to reduce their cost and maximize productivity. Again, the 2 ends could swap depending upon how successful we are in acquiring right-of-way. Some of the initial thinking from staff is with all the activity that's gone on in Visalia in the industrial park, that there may not be much right-of-way left to acquire in the Visalia piece.
And it's my understanding, Mr. Cox, in conversations with staff, that even though it's a phased, it will actually have the appearance of being one continuous project, right. Essentially, because it will take them 2 years to complete this project, but it will be almost continuous construction probably throughout that entire time.
We would hope it to be out to bid on the second phase before the first phase ends. One of the benefits from that is the contractor that's already on site may have a competitive advantage in that he doesn't have to, relocate equipment. He can just move his scrapers up to the other end of the project, and that might help us in the bidding process. We did talk briefly about trying to do both ends at one time, and then we recognized that either the contractor is going to have dual sets of equipment, or we'd have to make the project longer, and you'd see all this heavy equipment moving up and down Dinuba Highway, Alta, impacting traffic. So we're looking, because management of traffic control is going to be a critical function because of the amount of traffic that uses that roadway during construction. We want to minimize the impacts on the motoring public during construction.
So wherever you might have willing sellers then is where this most likely will kick off first.
As long as it's in a logical segment. We can't have 4 in the middle and 1 at one end. It's just not going to work very well, but yeah.
Right.
If there's no further comments, Madam Chairman, I would move approval of this item.
Second.
We have a motion and a second. Cast your votes, please.
Thank you, Board.
Passed.
Motion passes.
And if the Board desires, we could come back with either quarterly or every 6 months updates to kind of give you a status report of where the project is at.
I would certainly appreciate that.
Okay. All right, great. We'll plan for that then. Thank you, Board.
Thank you, Brett, very much. Okay. Can't stand this. I mean, this is exciting. This is big. And everybody's wondering, who is this handsome gentleman at the end of the dais?
Bearing gifts.
And I yes. And I'm ready to do that. However, I've been told I need to stick to my timeline. Oh, you're giving me permission now? I can start? Okay, I'm going to. It's a very exciting morning for Tulare County. I'm very happy that those of you that are out in the audience this morning could join us. Every once in a while, opportunities come along that we hope will come, that we try to plan for, but we're never really sure. And on that happy note, it is my distinct honor and pleasure this morning to introduce Mr. Henry Renteria, who is the Director of the Governor's Office of Emergency Services. Mr. Renteria was appointed in May of 2004 by Governor Arnold Schwarzenegger to his cabinet as Director of the California Governor's Office of Emergency Services, or OES, as we like to call it, after a long and distinguished career that has included directing emergency response and recovery efforts in California and Texas. Since his appointment as OES Director in 2004, Mr. Renteria has directed response and recovery operations for 5 presidential declarations of a major disaster, 1 presidential declaration of an emergency, and 34 fire management assistance grant designations. Prior to his appointment as Director of the OES, he led the City of Oakland's Office of Emergency Services, where he coordinated the city's response and recovery operations for the 1991 Oakland Hills firestorm, the 1989 Loma Prieta earthquake, and 4 other presidential declared disasters. Also during his tenure in Oakland, he helped design and implement the original Emergency Managers Mutual Aid Program, deployed for our use in Southern California following the 1994 Northridge earthquake, and was involved in the original design and implementation of the Standardized Emergency Management System, or SEMS-SIMS. He was also responsible for citywide disaster planning, response, recovery, and mitigation programs, and management of homeland security and hazardous material regulatory programs. As the Director of the OES, Mr. Renteria is a member of the National Emergency Management Association. He is a past president of the California Emergency Services Association, a member of the International Association of Emergency Managers, and on the Board of Directors of the American Red Cross. To say that on occasion disasters happen and unplanned things happen in our world would be an understatement. Sometimes here in the Valley, we have things happen that we decry. It's an honor and a privilege to have you with us, Mr. Renteria. I know you have some special business to attend to this morning, but then I would also, when we're done with that item, ask if you could, I believe you have some information to share with us about a recent disaster here in the county, and so unless it's appropriate to talk about that first and stick to my 9:30 deadline, I will leave that to your discretion, sir, so we can let you make that announcement first, or we can go on to the good stuff.
Yeah, let's do the good stuff.
then, as I've stretched this as long as I can, even with my bad grammar, and I would, at this time, then like to turn it over to you, Mr. Renteria, welcome you to the county, and looking forward to what you have to share with us this morning.
Thank you, Chairperson Conway, members of the board, and citizens of Tulare County. It's a pleasure to be here today, and thank you for that very warm introduction. As you know, the Governor's Office of Emergency Services is known more for responding to natural disasters. However, we also support victims of crime and programs that help those victims and also to prevent crime. Through our Law Enforcement and Victim Services Division, we also help communities protect themselves from human threats. As we well know today, we are also responding to threats of individuals or groups of individuals. In this particular case, I'm referring to the fact that we are helping our communities to respond to sex offenders who often prey upon our society's most vulnerable individuals, our children. Habitual sex offenders pose a significant risk to the welfare and the safety of the citizens of California. With nearly 85,000 sex offenders living in California and 23% of those in violation of their registration requirements, local law enforcement has a very, very tough job. Governor Schwarzenegger recognizes this challenge. That's why he allocated $5.7 million in this year's budget to fund the Sexual Assault Felony Enforcement Team Program, also known as SAFE. The SAFE Team Program provides law enforcement agencies with the necessary resources to monitor, investigate, apprehend, and prosecute habitual sex offenders living within their jurisdictions. The core membership of these SAFE teams is comprised of police officers, sheriff's deputies, probation officers, prosecutors, and victim services organizations. This important program will go a long way in keeping our communities, particularly our children, safe from sexual predators. I'm proud to say the Tulare County Sheriff's Department was one of 7 counties throughout the state selected to receive a grant today through our SAFE program. So with your permission, Madam Chair, I'd like to invite Sheriff Bill Whitman up to the front to present the check.
Not only my permission, but my encouragement. Thank you.
Great pleasure, and on behalf of the Governor's Office of Emergency Services, to present to the Tulare County Sheriff's Department this check in the amount of $639,000 as recipients of the SAFE program for this year. So again, congratulations to the Sheriff, the wonderful grant that you submitted, and to all the citizens of Tulare County who are going to benefit from this. Thank you, sir.
Yeah.
Oh, that looks nice.
It's authentic.
You'll have a tough time giving this to the ATM, but
I think he'll try, though.
Morning, Sheriff.
Good morning. Morning, everybody. It's a wonderful day. I'm always happy to take a check anytime I can get it. I would first like to thank the governor for his assistance in helping us with this problem. I want to thank the board for your cooperation and help us pursue this grant of $639,000, and also you, Mr. Renteria. We're very humbled and very grateful for this amount of money. As you know, folks, we just have not had the money to do the job, the resources that we should be doing. The number that was quoted here today, 23% are not in compliance. Our resources have been limited, and we've done the best job that we could do with what we've had. However, every day, those in the Tulare County Sheriff's Department, and I know you too, are concerned about what's going on with these sexual predators, and we need to stay on top of them. We have over 1,000 290 restaurants in this county. This will give us one more tool to do the job that we need to do. No one in the Tulare County Sheriff's Department places a higher priority on anything in our community than our children. They're our number one asset, as you all know, and we appreciate the opportunity to work in correlation with the board to be able to go out and apprehend those that are not in compliance and keep a little bit better track of those that are out there taking advantage of our children and other people in our society. This is our number one priority, is our children, as we all know. So I want to thank the board, Mr. Renteria, thank you too, and most of all, Governor Schwarzenegger for his assistance in helping us with this grant. This will give us one more tool to do our job. Thank you very much.
Thank you, Sheriff. I have to concur, of course, with everything that's been said. We do appreciate the governor, especially his attention to the Central Valley. He's been such a good steward for us in recognizing not that we have special problems. I mean, this is a problem throughout the state, but that we need help, and we appreciate the fact that he recognizes that. As a board member, we appreciate the Sheriff's Department and your diligence in applying for these grants and sticking with it, getting the information straight, plus the opportunity that I know it will afford the department to do what it wants to do, to take care of these issues. I've already been hearing from constituents in some of my small unincorporated communities, and Sheriff, you know which ones I'm talking about the problems that we have out there. And this will go a long way in addressing that and making this county so much more safe and able to do what we do. So once again, Mr. Renteria, our gratefulness. Please tell the governor how much we appreciate it. I know that you will, and see him on a frequent basis. Board members, I know it is an action item, but are any comments?
Yeah, I'd like to also thank Henry and the Sheriff's Department for getting this grant and putting it together, because as a board here, public safety has to be our #1 concern, and is. And to be able to track these individuals and so the community knows where they are too is very important. So I'm to commend the Sheriff's Department and thank the governor and Henry for putting this thing together for us, and it's going to be a big asset to us. Thank you.
Madam Chairman, thanks for the opportunity to speak. I think this is very significant because of its proactive nature. Oftentimes in law enforcement we have to deal with the reactive. So crimes are committed, we react to crimes. This allows us hopefully to get ahead of the curve and work with enforcement to find those people who are, have violated their rules of probation or parole, and to get ahead of the curve. So from a quality of life standpoint, I can't see a more important type of function and grant for Tulare County. So I want to thank Director Renteria and for Sheriff and his troops for taking the time out and the trouble to do these applications. Are not simple things, and they're competitive. And as was stated, 7 out of 58 counties got these awards, and so your office to be commended, Sheriff Whitman, for a job well done. And we look forward to improving the quality of life in our, especially our unincorporated area of Tulare County, which, as you all know, is a large population. So thank you very much.
Supervisor Cox?
Thank you. What I like about this is that it has a lasting effect here. If you look at the breakdown, we get some hard assets with this as well that just won't be here today and gone next fiscal year. Well, we've got cars. Now, I don't know what a automatic cyanocrylate fuming chamber is, but I know we're getting one. And it seems,
those commercials again.
And it seems to me like it's got such a tough name, it ought to last a while. So with $400,000 of this going to some fixed assets that will be here for several years to come, I think this is going to have a huge impact on the county. A lot of times we get grants, we have to think about, well, how are we going to backfill it next year? Well, we're able to purchase, it seems here, items that are going to last several years, so this will be with us for several years to come. I want to thank the Office of OBS, Mr. Renteria, for your coming down personally and presenting this. It's been a pleasure meeting you and bringing some of your staff with you. We appreciate being one of the 7 recipients, and I know as I looked at this, I'm thinking, well, we're going to get several years of service out of this, so thank you very much.
So let's take action, but we're not done yet. But it is an action item, so the board would entertain a motion. The chair would entertain a motion, I should say.
Madam Chair, a motion to approve and accept the grant.
Second.
Motion and a second. Cast your votes, please. Unanimous approval. of those of us that are here.
Madam Chairman, I had a brief conversation with the director before the meeting and asked about this question about renewability of this, and it would appear that we may be in position to receive these funds for a period of years. So it's not just a one-time amount, and that's very important when you're talking about adding personnel costs, because you hate to hire the people, get a program up and running, and then have the money slip away and not be able to continue with it. So again, that's a very significant part of this grant. Thank you.
Very important part, and this board will do its due diligence and work in conjunction with the sheriff to make sure that we're in accordance and eligible every year and able to continue this. That would be wonderful. And since you're here, Director Renteria, I understand there might be something else that a report you can share with us, and we'd be
Yes.
grateful to have that.
Like I said, it's always a pleasure to be here, and it seems like I've spent a lot of time here this year, coming to the Valley with the freeze and the disaster that you had here. I am pleased to announce, we just heard before I came in, that we did get an extension on the disaster unemployment insurance program that you've requested. So we're still constantly negotiating with FEMA and the other federal agencies. As you know, this is one of the roles that the state plays in helping you make sure that you get all that you need to recover from this event. What may seem to be a non-disaster event to other parts of the country, it's very, very serious to us here in the Valley. We know what the long-term effects are from these types of events. And yes, you don't have people dying, or you don't have buildings destroyed because of this issue, but the economy can suffer greatly, and people's jobs have been lost, and people have been affected personally by this event. So we continue to fight on your behalf. We continue to work with FEMA and convince them and let them know this is a very serious issue for the Valley and for the state of California and for the whole country, because of the way that the state provides the agriculture for the whole country. So I am pleased to announce that, and we'll be keeping you updated as we go on with the federal coordinating officer, who is still here, and we continue to fight for all the resources that are necessary to bring you back to whole again.
Madam Chairman, may I ask a question?
Certainly.
Mr. Renteria, I remember there was a bill introduced to modify the terms of work unemployment benefits, allowing people to earn up to $200 per week and qualify for benefits. Is that still working its way through the legislature?
As far as I know, it's still working its way through. I'll get you an update as soon as I can on that.
Thank you. I guess I was going to real quickly, because it's very critical here, because we have people working, but there's this underemployment issue. And so I understand. I just drove by an orange orchard this morning, a grove, and men were busy out there picking, but we know that this is very sort of a short window, and then when they're gone, there's going to be this hiatus in there, and there's going to be very little work, and unemployment or underemployment will be a big issue. So thank you.
You know, it's very important to my district, the 5th district, because of southeastern Tulare County. Citrus is probably one of our #1 industries, so we were really affected by this freeze. So this is good news. Thank you.
Well, once again, I so appreciate you and your staff and the time you took to come down here. I think I'm not sure what you anticipated. I mean, obviously, we need to be prepared for emergencies when they happen. I don't think we could have a better person leading that charge than yourself. However, I mean, I'm assuming that we put you in place hoping that there won't be anything to do. And unfortunately, it's been a busy time for you and your staff. So I appreciate the fact that you came down, not only just for the grant, but the opportunity that you've, and all, as you mentioned, it's not your first trip to the county into this area. And although they weren't the best of circumstances, we really do appreciate you being here and your presence and all that you do on behalf of all Californians. So thank you again.
Thank you.
I think at this time we're going to take just a 5-minute break before we get to the regular business. So those of you that need to speak to Director Renteria personally, I'll give you that quick opportunity.
Good to see you.
I like John Davis's tie. I like his tie.
Point had 2 or 3 inches, over the weekend. Yeah, so they've had 6, 8 inches of snow.
Then they had it on the table. We were just fuming.
I know, forestry.
Ah, man.
Hey, Mike.
How it is for
Hey, I have Okay. Mike, thanks a lot.
Oh, thank you very much. Nice meeting you.
Interesting. He's actually said two shoes.
No, that's perfect. You got me where I need to be. Thank you. Okay. Board will come back to session, and we will move to item 3 on our agenda. Nope, we won't. That's 11 o'clock timed item. Who knew? We will now move to item 4, which is a timed item. Public hearing. Request from Health and Human Services Agency to consider adopting fee adjustments for clinical services effective July 1, 2007, in the medical marijuana identification card program, in the amount of $268, effective April 18, 2007. Good morning, Mr. Bullock.
Good morning, Madam Chair and members of the board. Item 4 is actually a combination of two separate fees that Health Services is bringing before the board this morning. And it may, I'll just make a suggestion, we might want to have the presentation first on the medical marijuana card, open that for public hearing and comment, and have action on that fee. And then subsequent to that, we can have Mr. Dabusky come up and present the clinic services fees, because I think it'll probably be a different constituency making public comment on the two different hearings. So that would just be my suggestion. And the medical marijuana hearing, it was just recently before your board, but it's subsequent to state modification of their rates. We are going to be bringing a change before you, and I'll have Ms. Elliott come up and explain that. Okay?
Okay, that'd be great. Thank you.
Morning. I'm Karen Elliott. I'm an administrative specialist with Tulare County Health and Human Services Agency, and I am here to discuss the medical marijuana ID program, a fee adjustment to it. This is a program that we started in Tulare County July 1st, 2006, and since we've had it in place, we have issued 17 cards to people in the county, which is way less than we felt the demand was going to be when we first started the program. We thought it'd be around 300 people that would purchase it during the year, but this has not just been experienced in Tulare County, this has been statewide. And in December 2006, based on this, the state increased its fee that it was charging us from $13 to $142. We came before the board on February 27th to increase our fee based on the lower demand. So the county increased their fee at the time, plus the state fee. We increased that fee to $344. It was approved by the board to be effective March 1st. This was on February 27th. And then the next day, February 28th, we got a letter from the state rescinding its letter in December 2006 from increasing its fee to $142 to increasing it only to $66. So we are now before the board again to adjust our fee based on this. The county fee we are asking for is will be $202, which we asked the board in February. The state fee, though, has changed. What we'd like to do is ask for the board to approve our fee of $268, but in future, we would like to just base our fee on the county-approved fee plus any fee the state will charge at the time, so we don't have to continue to come before the board if the state changes again. If we find a need to change our fee, then we would come before the board.
Okay, thank you.
And this is what the fee is calculated on. Do you have any questions?
Questions from board members?
No, if I can, I just see you're estimating that you're going to have another 8 this year.
Well,
So
you know,
you're estimating that these are based on 25.
You know, actually, I think we're kind of carrying it into, it would increase the fee considerably more. We have collected a little over $1,000 this year on the 17 cards. 50% discount continues to be on the Medi-Cal. Truly, we have spent about $5,000, so we still have around $4,000 to cover, and if we based it on 8 more cards, that would be even a lot larger, but we're trying to spread this out a little bit more. When I talk to anybody who calls up, it's very difficult to judge this. I have people who are advocates who feel that there will be people who will come and purchase the card. It's a voluntary program. They have said they will do whatever they can to raise money to help people pay for the cards, but at this point, the demand has not been high.
And which funding source supplements the shortfall?
There is no funding source that does supplement the shortfall. This is to be a fully fee-supported program, so this will be a discussion we'll have to have at the end of the year when we do have a shortfall.
So the general fund would cover it then?
General fund, whatever, revenue we can find in the Health Services Department to cover it. It would not increase our net county cost.
Okay, any other questions? Okay, well, this is a public hearing, So I will open the public hearing at this time. Anyone that wishes to address the board about the fees for the clinical services? Now would be the appropriate time. I'm sorry. I thought we were doing two separate things. Yeah, easy for you to say. Okay, seeing and hearing none. Close the public hearing, bring that back to the board. Mr. Bullock, did you identify another area that we want to include?
Yes, the other item is the clinic services fees, the fee-for-service charges for services in the clinics. Mr. Dubusky presents that.
Okay.
Thank you, Madam Chair. Steve Dubusky, Deputy Director, Health and Services Clinics. Last time we looked at the clinic fee schedule was in 2002. The schedule is quite voluminous. It's 80-some pages of medical procedure codes. We took a look and did a cost study of what our actual costs were for the top 20 procedure codes, and we're recommending adjustments to what our costs are. For the remainder of the codes, we're recommending a 5% across-the-board adjustment.
Questions from board members?
Madam Chairman, just for purposes of understanding, we have these fees. It doesn't necessarily mean that we actually charge these fees because we have sliding scales based upon people's ability to pay. Is that correct?
Correct. We receive designated rate for Medi-Cal and Medicare. This doesn't really apply. It only applies to cash-paying patients who could apply for the sliding fee scale.
If I may, and what percentage of the patients are cash pay on the sliding fee scale?
A good number of them, but actual revenue is only about $200,000 a year. So the impact of this is probably about $11,000.
That was my next question. Thank you.
Okay. Well, this is a public hearing, so is there anyone that wishes to address the board on the fees recommended from clinical services? This would be a time to do that. Okay, seeing and hearing none, bring it back to the board, and this is kind of a combined motion, but...
Madam Chairman, I would move approval of the requested increases in the medical marijuana identification card program and the fee adjustments to the clinical services effective July 1 of 2007, and as to the medical marijuana effective April 18th of 2007.
Second.
Okay, a motion and a second. Cast your votes. Okay, motion passes. Thank you. We'll now move to item 5, public hearing, once again with Health and Human Services.
Again, item 5 is a continuation of the public hearing that was initiated last month for consideration of clinic services and resolution of anticipated budget deficit for 07-08. At that hearing, staff was asked to go back and study two specific issues. The first being the issue relative to the designation of rural health clinic status in Dinuba, if there was any potential impact as a result of our discussions on that designation. And we've had subsequent conversations with the state, and they have recommended at this point already continued designation for the area as a health provider shortage area. And so there's no anticipated adverse impact to that rural health clinic designation as a result of the actions we're contemplating. We've also had discussions with Dr. Tusu, who brought that forward, and I believe at this point he's comfortable with the language that he received from the state. Mr. Dubusky emailed that to him. The other thing that we were asked to do was to assess the capacity, the actual capacity in the two service areas that we're contemplating the service reductions. And staff has done that. They actually completed a fairly exhaustive template for a number of clinics. in which they assessed the numbers of patients that could be accepted, the types of patients that they could accept from a service perspective, whether it's family practice only, family practice, pediatrics, OB, specialties, if they provided any certain levels of specialty. And based on that assessment, in the Dinuba area, here's where I need to refer to my notes so I get it all right. I'll just actually mention the clinics. Maybe that would be helpful that were assessed as part of this template. Dinuba Medical Center, Dinuba Rural Health Center, Sierra Kings Women's Health Center, Alta Family Health Clinic, Vermont Family Health Clinic, Dr. Maida, Central Valley Family Health, Dr. Shannon's Clinic, and Sierra Kings Family Health, in addition to the anticipated patient volume that would come down to the Visalia Health Center. There's more than adequate capacity to accept all the patients that we have in the currently active in our Dinuba clinic. In fact, as we were approached by at least 2 clinics that were interested in absorbing all of our patients, and in the public discussion that occurred at the Dinuba City Council meeting, I think there was some clarification attempted at that point by Dr. Tusu and Mr. Moore, and they also heard from Ruben Chavez of the Family Healthcare Network and Dr. Charles from the Adventist Health Group, that there was an interest in working with and developing capacity if that was necessary for certain types of specialty. But at this point, I'm very comfortable in mentioning speaking to the board that there is adequate capacity for the patients that I've seen in the Dinuba clinic. As it relates to the survey in Porterville, the same survey was completed in Porterville with the Porterville Women's Medical Association, Sequoia Family Medical Center, Family Health Care Network, Success Valley Medical Group, Dr. Dunn, Sierra Foothills Medical Group, Vita Sanya Clinic in Lindsay, and the other clinic, of course, was the Lindsay Health Center that we anticipate absorbing all of the TCMS clients and a certain amount of the managed care clients that would come with due to provider loyalty. So again, the same analysis was completed in Porterville, whereas we don't have the same level of excess capacity that we have in Dinuba. We clearly believe we have adequate capacity to accommodate the patients that are being seen in our Porterville clinic site, both on an absolute number of patients as well as the visit volume. So we believe that in answer to your charge back to us 3 weeks ago to go out and evaluate these 2 concerns, we've addressed both concerns. We believe that there is adequate capacity. We believe that the issue relative to the rural health clinic designation question was adequately resolved. And I've taken the liberty at that point. We also heard during the testimony portion about the need for a plan. And let me see if I can exit this. You got the controls up there to... There. Transition, right there it is. Okay, we were asked to share our actual plan for transition of these patients in the event that the decision is made to move forward. And so what we have is basically a plan that has a 3-pronged element, the first being that of a personal contact with patients, the second being a mail-out and response part of the plan, and the last being a long-term for those people that we aren't able to either get in touch with or contact on a personal basis, a long-term basis for retention of those records and transition staff. So maybe just briefly we'll talk about those 3 elements of the plan. The first being if the board makes a decision to close clinics, the first thing we would need to do is to train up personnel in the area of transitioning these patients. That would be individuals that could actually meet with them. It would be our expectation. If they're seen in our clinics between now and the time that it's designated for closure, it's the expectation that when they're in the clinic, they'd actually meet with that transition person, go through the list of potential options for transitioning their medical records and their care. And of course, if it's a managed care client, we would have to send that patient information, that patient selection, to the managed care plan so that they could also make that accompanying change. So we would actually train someone. It would be a face-to-face visit with people that come into the clinics between now and the date of closure to assist them and facilitate that transfer of care. The next, it would be that mail-out program. At a minimum of 60 days prior to closure, we would send out a letter that would notify the patients of the impending closure. This letter would be in the language that would be their primary language, and it would also indicate that they need to make a selection for another medical home. And in the event they don't understand the letter, or if they would like to make a call for assistance, there's going to be a request that they call these transition staff that have been trained in each one of the clinic sites. And if there's still no ability to get a hold of them, we would then move to what we would call a second mailing, that you've been identified as someone not responding to the first mailing. And at that point, rather than leave it up to them to mail something back, we're just going to be encouraging them to make a call to the clinic. It's very important that you call our clinic and use that type of contact to assist in making the transition. And anybody that doesn't respond, we will have those transition staff working daily to make contacts with people to see if they can identify where they want to obtain care. Or of course, if they want to transfer to another county clinic, that's always going to be an option. So that's basically the plan for the contact portion. Now, we know, or we expect, that there's going to be some segment of the population that we are unable to contact. So we will be retaining the medical records at our Hillman Health Center location, and the transition staff will be maintained for that sole responsibility to assist people if at some point they do make a contact, or if another medical provider contacts us and says, we have a patient that used to be seen in your Dinuba clinic, I understand you might have the records. Those transition staff will be kept on board to assist in those transitions for 4 months after the closure date. So hopefully that gives a little bit of a picture of the plan that's envisioned for the actual transition of the patients if the decision is made to close. And I do need to add that subsequent to our conversations 3 weeks ago, we've actually had 2 healthcare providers tour our facility in the Porterville clinic with an interest in potentially using that site as an expansion site for their own services. So there has been some contact stimulated as a result of our discussion 3 weeks ago, but I just wanted to bring that before your board as well.
Questions, Supervisor Brooks?
Ray, I think the only thing that I've heard that you didn't cover was concerns about transportation. Some might have had concerns about being able to get from one clinic to another. Can you briefly address that?
Yes. We anticipate that we will be further developing. We have a Call for Care van program, and we need to further develop that Call for Care program to include the Porterville area. Specifically for our MIA population, I think this is essential, but if we can accommodate a larger portion of the population that might select county clinics as their medical home.
MIA is medically indigent?
Medically indigent adults, excuse me for my acronyms here, otherwise known as the TCMS program in Tulare County Medical Services. So we need to further develop that program. One of the things that we need to see is just how many people select those distant clinics as their medical home. Clearly, if someone selects, say, the Dinuba Health Center, it's not that, it's very proximate to where our existing clinic is, so if they can get to one, they should be able to get to the other. So the primary transportation concern would exist for those TCMS patients and the patients. We heard from Ruben Chavez, and again, I think he brought forward a valid point that there's a fair number of the patients that we see in our Dinuba Health Center actually come from that Cutler-Rossi catchment area. They have a clinic in Cutler-Rossi, and I believe they also already have a van transportation program. So that might be another means to accommodate these people if they select a clinic closer to their home.
Madam Chair, I did think of a question. I know that I've had folks who have the clinics in the Dinuba area state to me they're willing to negotiate with the county. I know the county said they're willing to negotiate that they would provide the services to our indigent adult population. Have you had conversations with anybody about that?
No, and again, we already have private providers that are seeing some of our Tulare County Medical Services for specialty, and so we'd be happy to talk if people are interested in both the specialty access as well as the primary care access for expanding those contractual relationships.
And also, I think it came out at the Dinuba Dinuba City Council meeting last week that a question was asked about the numbers of adult indigent population in Dinuba, and I believe you told us a little over 200 people, I think, we're talking about.
It's a little over 200 that are in that medically indigent adult program, the TCMS program in that Dinuba clinic.
Thank you.
Ray, in the Porterville area, one of the concerns was OGBYN. Have we looked into?
In the capacity, the assessment that we conducted, there was more than adequate capacity from the Women's Health Clinic and one of the other providers, and I forget who exactly it was, that indicated that our numbers of OBGYN that we're actually following in the Porterville area are not that high. When we looked at what we were seeing for OBGYN.
I think it was Dr. Ebaugh, wasn't it? Wasn't it Dr. Ebaugh?
Dr. Ebaugh is one of them that's very interested in taking, and I can't remember the name of the other provider right off the top of my head. And when we surveyed Family Healthcare Network, they just gave us a number, and so I didn't break it out by provider types. So, but they also have OB services.
Ray, do we currently provide transportation to our clinics? I mean, do people call us up and say, I want to come to your clinic and I want you to come and get me?
Yes and no. For certain types of services, it's an absolute yes. For our TB patients, for certain types of patients that we have to get into CCS or specialty cares, we use community health techs, and we do a lot of transportation. For general family practice, we've tried to evolve this van transportation program in the Dinuba area. It's not been as successful as we would have liked it to be, but we believe that we can re-engineer that and make it more fitting and appropriate for our patients.
I had another question. Just in my experience with this, with the clinics, that as more and more of the private nonprofits, or whatever we want to call the other clinics, the actual FQHC clinics, as more and more of them come into existence, and it's happening every day. Somebody opened one in Pixley the other day. I mean, to me, it seems like a business, if you will, that people are interested in being in. That has a direct correlation on the amount of patients we see, doesn't it?
That was brought out by Mr. Moore in his testimony, that in 1981, when we went into Dinuba, we were the only clinic, and now he indicated that we were competing with 10. I think it's closer to 8 other rural health or FQHCs in the Dinuba area. But yes, that definitely has an impact on the need and the type of patient that we're seeing.
Okay. Any other questions from board members? Okay, the public comment part of the public testimony of the public hearing was closed at the last meeting, but we certainly want to give people an opportunity to comment, because I know some of you want to. So it's not the board's intention to, just because the public comment part is closed, it's not the board's intention to keep people from speaking that would like to. And in fact, I'm actually interested in hearing from some of the folks that signed up to speak, because I have questions too. So the first, this is in random order, in a stack here. Perry Foster, Mr. Foster from Family Healthcare Network. Oh, and for the record, just because you didn't sign a paper doesn't mean we're not going to allow you to speak, just in case you got here late and don't have your name on the list. Good morning, Mr. Foster.
Good morning, Madam Chair, and the rest of the board members. I'm Harry Foster with Family Healthcare Network. I reside at 5929 West Buena Vista Court in Visalia, California. I appeared before the board at the last meeting to talk about this issue, and subsequent to that, went to my board of directors and received authorization to enter into discussions with not only county staff, but Sierra View District Hospital and the communities of Dinuba and Porterville. We have acted in very good faith in meeting with not only community and hospital representatives, but your staff at Health and Human Services. We've made a commitment to try to develop a plan to address the issue as we see it, particularly in Porterville. I have to give you a report on the resources survey that was conducted. The question that was asked in that survey might be a little misleading in terms of how much capacity really exists, because I think the pertinent question was, are you enrolling new patients? And in our case, we would say yes. Can we enroll 5,000 new patients? No, not with the existing resources. Secondly, and I say existing resources, I'm talking about both bricks and mortar, and I'm talking about staff, professional staff. And it's our intention, and we shared this in good faith with the county staff, to seek employment opportunities with some of the professional staff who are on board at the county clinic in Porterville and who need to stay there to serve that community. We're interested in employing those folks to the extent that they meet our requirements and are a good fit with us. It would be mistaken to think that an area, in either area, Dinuba or Porterville, both of which are health profession shortage areas for mental health, for dental health, and for primary care, can simply absorb something like this without leaving those resources there. So we would hope that that is understandable. We would hope that this board would consider our proposal to take 6 months to have a transition period where these folks would have a sound medical home at the end of that time. The OBGYN who was mentioned, specifically Dr. Eba, has plans to leave the Porterville area. I don't know whether you're aware of that. Our two OBGYNs are pretty much at capacity right now. They're delivering about all the kids they can deliver right now, and we're fervently searching for a third OBGYN to join them. But we're not going to be able to absorb those patients without additional resources. And we're not going to be able to turn that around before July 1st. We have told county staff that we have a fairly reasonable, rational, prudent plan put together that if we could get the right kinds of terms on the facility, as Mr. Bullock mentioned, and on having some professional resources, we could have a win-win situation in this issue. But we have to have about 6 months to do that because, excuse me, the bureaucratic things we have to go through. We would have to get relicensed. We would have to get another state Medi-Cal provider number. We'd have to get a change in our scope of project from our federal government partners. And for the record, Family Healthcare Network is a private nonprofit corporation, and we serve everyone regardless of their ability to pay, have done so for the last 30 years. So thank you for your time.
You answered. I have a couple questions, if you would indulge me,
Okay.
Mr. Foster. Because you and I have had conversation about clinics over the past 6 years or
Yes,
so
ma'am.
on a frequent basis, and I believe when I came on this board, I know you were in different location, at least here in Visalia, and since then have grown expeditiously. So you answered one of those questions, so that if a patient shows up today, regardless of ability or whatever, you don't turn them away if someone was to come to your clinic.
That's correct.
And then another thing sticks in my mind because of other conversation that we've had, and that's about transportation. Do you provide transportation to your clinics, or?
We provide transportation at the Porterville site and at the Cutler-Orosi site. And in fact, we suggested in the hearing held in Dinuba that we do have capacity in our Cutler-Orosi site, because we're currently expanding that site to take on more patients. And we would be more than happy to do that. It's 7 miles out, and what we would need is probably some type of an arrangement to beef up our transportation system. We currently have 2 vans serving mostly in the Santana, Orosi, and Cutler area. And to go and extend that to Dinuba on a half-hour basis, we would need 2 more vans. And it would be very easy to accomplish.
But federal dollars may be available for such programs. Yes.
Sure. One point I wanted to make about this was that the Dinuba Clinic probably does service a certain number of people from the Cutler, Orosi, Yedem, Seville, Sultana areas now. Those would probably be the likely ones who might want to go to your clinic there because of its proximity. But that's just, the focus was kind of on as the report was, about the capacity in Dinuba, but the fact of the matter is there are other health clinics in the Cutler-Orosi community, yours being one, that would also stand to perhaps receive some of these additional patient loads which would come from the closure of the Dinuba.
Yeah, I wouldn't want to mistake the survey that was, the results of that survey with what the real need is out there. Because the entire county is a health profession shortage area. We right now have too few resources.
Entire valley.
Well, I'm just concerned about our service area, to be honest with you. I'm really concerned that we abandon anyone. And we're looking at trying to help in any way we can, but we can't help with one hand tied behind us. We really need all the resources, and it's not an issue of going after more federal money. It's an issue of trying to take care of our own right here in Tulare County. So I appreciate your time. Thank you.
Thank you, Mr. Foster. Dr. Tusu?
Good morning, Madam Chairman. Good morning, Board of Supervisors. Thank you very much for giving me this opportunity. Let me start with the staff at Tulare County. They've been very proactive. They've spoken with us. They came to Dinuba, and they gave me an email of correspondence between them and a state authority regarding the rural health status. They were told over the phone, yes, there is a 3-year extension. I have worked with these gentlemen in the past, and I believe them, and I think we have a 3-year breathing space. I want to still go on record. I have some friends in other counties where health care professionals have not paid enough attention, and they had a hard time because they lost their rural designation. As supervisors, I would request you to ask yourself this question: what happens 3 years from now? That's number one. Number two, when the staff came to Dinuba, and we have been actively talking to them, and as Mr. Foster said earlier, we will be able to take care of the primary care patients. The question I want to pose is, the way I see it, there are 4 components to the healthcare delivery system. There's the public health component, there's the primary healthcare component, there is a specialty care component, and there is a hospitalization component. Once you guys close, what's going to happen to the public health component? There needs to be a plan. There was a nurse who came to the meeting the other day in Dinuba, and she said there are 200 kids who are not immunized. What if there's a kid with meningitis out there who has not been immunized? An uninsured kid is going to hurt other people. What if there are teenagers who are going on with chlamydia or gonorrhea? The other clinics don't have the capacity to do that, to take care of public health issues. If you guys close, who is going to take care of the public health issues? Lead testing. If somebody is committing suicide and there's a crisis prevention needs to be taken care of, who is going to take care of those issues? Those are very, very important issues that need to be dealt with. They need to be thought out. They need to be planned. Again, as I said, we will be able to take care of the primary care component. That should be a non-issue at all. We have some specialties in our clinics, all said and done. Other specialties, we can refer them. What happens to these 200 people who need hospitalization? Who's going to pay for their hospitalization? Who are uninsured? How are we going to have a plan? And all that needs to be addressed as well. And as Mr. Foster said earlier, he needs some time. I relate to where he's going to. He needs designation, he needs to create a satellite clinic, policies and procedures have to be put in place. And the many people I offered in the Dinuba meeting jobs to people who work for the Dinuba clinic. Many people came to me. I have interviewed some people. I have pending job offers, but I do not want to take them away pending your decision, because I'll be just hurting the patients who are being served here. We are all here in the business of taking care of patients, and patients come first. I came to the U.S. from India. India has made me who I am. America has given me what I want. Yes, I'll gain some more patients, but I'll be, my moral and my professional duty is towards the patient. And if I say that I have everything, I'll be lying. Who's going to take care of the public health? Who is going to take care of the hospitalizations? And you need to think about all those things and before you make your decision, and there needs to be a plan. And thank you very much for instructing your staff to come to me. They've been very nice, and we have talked about the primary care component of it, but there's a bigger picture out there.
I'm sure. I think I can respond to a couple of comments, and Ray may want to speak to some things. The TCMS patients are not abandoned. They are still covered by this county. Those are the responsibility areas that we have. Historically, our responsibility has been to the medically indigent adult population. And so nothing changes. They are still, in fact, at the last hearing, I don't know, Ray spoke to the fact that, maybe it was at the Dinuba Public, at the city council meeting, that is really where most of our TCMS funds go. It goes to the critical care hospitalization costs. Those don't go away, and our obligation doesn't go away. The fact that the clinic closes, the clinic is not a hospital, it doesn't provide hospital services. So there's no change in that circumstance. Secondly, in my conversations with you, because one of the things I didn't realize, this has been an evolving learning process for all of us, I'm sure, was the scope of our clinic in Dinuba, where we talk about, I think, about 3,500 patients load, something like that. Your clinic has 35,000 patients.
We have patient visits, 35,000 patient visits.
And you see, now I begin to understand the scale of things. You are one clinic in Dinuba with 35,000 patients. We are one clinic in Dinuba with 3,500 patients. I think the presentation of this to the board could have been somewhat different. In Dinuba, the issue really would have been, why are we there? Because we are, when we started, and I want to speak to this later on when I have some comments to make, excuse me. But when the county went there, our responsibility was to these limited income individuals, a very small number of people. They were all treated at the Tulare Hospital, a county hospital. When the county hospital closed, in an effort to try to deal with these patients, clinics were set up around the county, and Dinuba was one of the first. But it was the only clinic in Dinuba. Therefore, we received our indigent, we received a lot of Medi-Cal patients, we received a large population of people who were not being seen by other physicians. What's happened in the meantime, as was alluded to by our chairman, is that there's been a proliferation of clinics, yours being one. Yours did not exist at the time, and certainly it didn't start off with 35,000 patients. But as I begin to understand it, what's happening is that the market is changing. The market share for Tulare County is doing this. And that's probably as it should be, because we're a governmental agency. We're not in the business of providing health care. We have a health care responsibility to a limited population of people. But as other people step in and take over that responsibility, that's as it should be. And so the issue here is there's savings in closing these clinics, but also there is a realization times change. And so what was right to do in 1981, we have to look at where we are today. Does it make sense to be there today? And, you know, you've indicated to me, and I understand I had to leave the meeting tonight, but Ray tells me that there were 3 members representing 3 different clinics who all got up and stood in front of the meeting and the board and before the city council and said on the record that they have the capacity to take all of our patients, because all of our patients is very small.
Exactly, I agree with you.
There's a large population base out there, and what the county's handling is a very small part of it. I think we need to keep this thing in its proper context.
Absolutely, I agree with you. We will be able to take care of the primary service component. There is no doubt about it.
And then let me address the county health issues, because this was something that was brought up at our last meeting. One of the reasons we're looking at closing these clinics is so we can be better at our health care responsibilities. Our public health component has suffered because we are taking funds now from public health to help keep the clinics alive and open. So by taking the funds that we are now spending on clinics that are, in the Dinuba case, essentially unnecessary, we're going to be able to beef up the public health component, which is our primary responsibility. And I think maybe it might be good if Ray could address that particular thing, because you've raised the point, what about public health in Dinuba, and perhaps you might want to address that.
And don't forget mental health.
That's another issue.
Thank you. You spoke very, very eloquently on both items, especially the TCMS. We have that very limited, and that won't go away. We will still have both the financial obligation and service obligation for those medically indigent adults. As it relates to the public health, that is, for me, the real crux of this discussion, because for many, many years, especially since 1991, public health has been taking a back burner because we have just been subsidizing the increased burden of the acute care, primary care patients with the resources that have been coming in. So our public health has quite candidly suffered. And I'll just give you an example of something that's happened recently, because we don't have adequate public health infrastructure. We recently had three different schools in, well, I'll just leave them out, but with varicella outbreaks. Ideally, what I'd be able to do is I'd be able to take public health staff into the school sites to immunize those children. I don't have adequate staff to do that, so what did I have to do? I had to use the poorest practice possible in medicine, send potentially infectious kids to their clinics to receive an immunization that would have been much better handled in some sort of a mass immunization clinic. We don't have the resources, so it's that type of a thing that we need to rebuild. We do have a mobile immunization clinic. We already are serving people up in the Dinuba area with immunization services. We do need to rebuild sexually transmitted disease and family planning services, those things that are typically associated with public health. We've had, over the years, those services have been gutted, quite frankly, and we need to rebuild, and that's something that the action today will not enable us in the 07-08 budget to say, I can rebuild it. All this will do is help us stop the bleeding, and if you recall, 3 weeks ago we had the discussion, we've actually got a $3 million deficit. The clinic closure is going to allow us to make up about 1.5. We have to become more proficient in the remaining staff that we have and what we're doing to make up the balance of that. So I'm very, very keenly aware of the public health shortfalls that we have in this county. It's not something I'm proud of, but I feel it's my obligation to bring that forward and build a plan to rebuild our public health infrastructure, and this is just part of that. So thanks for the opportunity.
What do we do? Say, for example, I have a patient with gonorrhea, chlamydia, or HIV. Normally, we have been sending them to the county clinic, and the county kind of reports back to us. What is the new process going to be?
There's two parts to that program. There's the communicable disease investigation as far as the contact tracing and the contact monitoring. We have on-site communicable disease investigators and one state-supplied STD investigator that is actively pursuing. Can't pursue all chlamydia because we got too much. We'd love to have more of these positions. We now have extensively resistant, drug-resistant gonorrhea cases, so we have to be very careful. And of course, all syphilis cases are traveled. We travel out. We try to find their contacts wherever they can be found. We are responsible for bringing them in for treatment. There's nothing that says we have to bring them to a county clinic. In fact, Ed and his staff bring them to whatever clinic they identify that they want to go to for either prophylaxis or for active treatment if they've got disease. So there's nothing magical about bringing those individuals into a primary care clinic that's operated. The thing that's important is that that public health linkage be established. And so I'm not saying we're going to pull out, we don't have any CDIs and communicable disease investigators stationed in Dinuba, but we clearly cover that area with our existing staff, and that won't go away.
Having said that, it's very, the question I pose myself all the time is, what is the responsibility of the county towards the health care of the citizens? I don't know. From a governance point of view, what responsibility does the county have towards the health care of its citizens? That's number one. So how about emergency preparedness plan? So tomorrow, God forbid, something were to happen in Dinuba, what are we going to do?
Wait, Madam Chair, you're really kind of getting off the base here, because when it comes to primary care, our limited responsibility is to the medically indigent population, the 200 people in Dinuba. Obviously, we provide a plethora of other services. And you just mentioned the medical emergency services is one of the things the county does. There's a whole umbrella of other things that we provide through Health and Human Services, but our county responsibility when it comes to primary health is a very limited one. And I think there's some misunderstanding about that, because the fact we've had a health clinic there, which is providing a lot of services to a lot of different people. But, so that's the situation.
Thank you very much.
Thank you, Dr. Tucson. Mr. McKittrick? Sorry. I should say Dr. McKittrick? Only not MD, right?
Not MD.
Too bad. Put him to work.
It's too bad I haven't got an MD, but I can't issue pills or anything like that. But anyway, I do all the education, but not the medical. Anyway, thank you very much for letting me speak this morning. Madam Chairperson Conway and members of the Board of Supervisors, I'm Dr. Terry McKittrick. I reside at 359 Village Drive, Dinuba. I'm mayor of the city of Dinuba. Now, I appeared before you at the first hearing, and at that time I asked you to reconsider closing the clinic in Dinuba. Well, here I am again today, second time appearing before you, and my plea is still the same. I'm asking you to reconsider closing the clinic. I'd like to read, by the way, too, we sent you a letter at the first hearing.
Which we have.
You don't need to read the whole thing, I don't think, Mr. McKittrick. I mean, we have read the letter.
Oh, no, I'm not going to. No. No, Mr. Worthley,
Yeah, I didn't start the time clock, but
okay.
the chair will.
Oh, no, I've got 3 minutes, and I know that. But we sent you a second letter after our council meeting, and our work session on the 10th of April. I'd like to read just a few parts of this letter because I think it's very important. At the April 10th, 2007 City Council meeting of the City of Dinuba, the Council voted to oppose Tulare County's plan to close Tulare County Health Clinic in Dinuba after listening to 3 hours of public comment. It was a long evening, but it was well worth it. It was the conclusion of the City Council that the Tulare County is responsible for ensuring that individuals receive adequate health care services throughout the county. The Dinuba Health Clinic has been open since 1981. This county facility is an important part of Dinuba and the surrounding communities, providing family practice, pediatrics, obstetrics, and gynecology services. Now, the northern part of the Tulare County currently receives limited services, as we all know, from several social service programs provided by the county. The population of Dinuba is over 20,000 and growing. The population of the surrounding rural area has an additional 16,000 and it's also growing. But other cities within the county, such as Visalia and Tulare, have hospitals and larger health clinics providing basic and expanded medical services currently not being provided in the northern part of the county. But based on information provided by the county, the cities of Visalia and Tulare play a larger role in the county health care deficit than all the other Tulare County cities together. But yet the city of Dinuba, which accounts for 6% of that problem, of the deficit, will have its county medical services reduced 100%. In other words, it'll be closed. Okay?
We have a hook that comes out.
Yes, the hook comes, yeah, okay. I'm waiting. Okay. Now, if Tulare County closes its Dinuba Health Clinic, there will be a very large adverse impact on Dinuba and the surrounding communities. Tulare County receives funding from the state for medically indigent individuals. Local private clinics in our community have no obligation to serve individuals who are medically indigent, and there is not any requirement for them to do this. Okay, at the Dinuba City Council hearing on April 10th, we received testimony that individuals have been denied services from private clinics, and this will increase. That'll be a financial hardship for individuals to travel 25 miles one way to obtain medical treatment in Visalia because of limited income and transportation means. And the ambulance service, our service, calls in this area will increase due to transporting more of the medically indigent patients to Kauai Delta and Reedley hospitals, because there will be not a county clinic in our community to provide medical services to these individuals. There will also be a dangerous increase in the number of individuals who will have their medical treatment delayed or deferred. And folks, being the mayor of Dinuba, I am very, very concerned about our people. I know you are too. But as my status is the mayor, I really am concerned about the patients and what kind of service and medical treatment that we can provide for them. And I don't want to see anybody turned away, delayed, or deferred. Okay, we also received testimony that the county for almost a year has failed to provide mental health services for adults in our community, which is also a great concern for us. So mental health is very, very important. I know that facility burned at one time, and after that, our mental health services were suspended. So we really are concerned about that.
I could address that if I might, Mr. Kittrick.
Yes.
That's not a true statement. It was true that they had to move out of the facility, but the services have continued to be provided in Dinuba. Mental health comes to the community, provides services there, and it's necessary they transport them to Visalia. The county provides that transportation to them. So the services are being provided. They're just not being provided from a bricks and mortar standpoint within the community. Okay. And one of the things that you and I had a conversation about last week, and I spoke with our staff, part of the logic here in terms of why we would look at closing a health care clinic is to make sure that we have funds directed in the places that they're supposed to be. County health is, public health is one. Another is mental health. So one of the ways that we have bridged this gap of shortfall of revenue to expenses has been to transfer mental health dollars into our clinic program to keep it afloat. So I have spoken with our Director of Health and Human Services and have gotten a commitment from him that Tulare County will reestablish a presence for mental health in Dinuba. And I think this is very important because when you look at the health overall component for any community, and Dinuba, we'll talk about Dinuba because we're talking about that community, mental health is a very significant part of providing health care in a community. We have a number of people who are engaged in physical health, primary care providers. Some may or may not provide mental health. I'm not aware of that. But it's my understanding that the real shortage in Dinuba is mental health. So by strengthening mental health for the county in Dinuba, we're going to create a better overall umbrella of health for the community rather than keeping open a clinic that is draining resources from mental health to keep it open. So I see that as being a win-win situation for the community. The commitment by the county will be to reestablish a presence in the community for mental health, and we have been providing the services, but there will be people actually stationed in the community so that there's no question about the commitment of the county to the community of Dinuba and its surrounding areas. But part of doing that is the need to redirect the dollars where they're supposed to be. And the dollars are supposed to be spent on mental health that we're now spending for providing, again, the subsidization of the health clinics. So that is, I think, an important point. There are some issues in this letter. Again, it goes back to Dr. Tusu's comment, which is, what is the responsibility of the county? And there's a generic kind of a statement that the county is responsible for everyone on health. And it's not. The county's responsibility is for those 200 TCMS patients, those medically indigent patients, and they will not be abandoned because they will either be provided services by the health clinics that are willing to contract with the county in the community, or we will provide the services by transporting them to Visalia. They will not be forgotten, and we're talking about 200 individuals. So that is the legal responsibility of the county is to those people, and they will continue to receive those services. So I understand it's always difficult. Nobody likes change. Nobody likes to lose something. Nobody likes to see a situation where an existing clinic that's been there since 1981 is going to be closing, and on the kind of first blush, you look at that, you say, well, that's a bad thing. That's a negative thing. It may be or it may not be. I think when you evaluate all of the situation, when you look at the capacity of other clinics within the community to provide those same services, the very elaborate system that the county is going to go through to make sure that every individual is contacted by one way or another, they will be contacted so that they know about the closure, they will know about their options, they will know where they can go to receive care. By contracting with TCMS patients to be provided in the Dinuba, and strengthening the mental health component, and strengthening our county health requirements, public health requirements, I just see this as being a positive thing, even though on the surface it may appear to be negative. And I'm sorry that we have done a very good job of communicating that, perhaps.
It does look negative as far as, closing, of course. But we just ask that you consider all the facts and all the circumstances leading up to this. And we just want the best for our constituents and our community people. That's all. Okay? Oh, can I ask you one thing? Now, if you decide to close the clinic in Dinuba and the clinic in Porterville, are we guaranteed that that money that is being saved will be used for medical purposes or health purposes?
Oh yeah. The money has to be used for health services. It can't
so it has to be.
Oh, yes. Yeah. This is money that comes to us from the state and federal governments that we have to use for health.
So you're accountable.
It won't go towards roads.
Well, we need roads too.
Or the sheriff. It'll go toward. It stays in the health arena.
Okay.
We've been borrowing from one health area to cover another, and it just goes back to where it's supposed to be.
Okay, as long as we're guaranteed that that money will stay in the health arena.
We've passed all of our audits. I think we're fine.
Okay. I just ask you to reconsider. Thank you very much for letting me do this.
Thank you, Mayor.
Thank you.
Dennis Coleman.
Madam Chairman, Board of Supervisors, my name is Dennis Coleman. I'm the Chief Executive Officer and President of Sierra View District Hospital in Porterville, California. And I'll make this very succinct and to the point. On behalf of our Board of Directors and Senior Administration at Sierra View, our recommendation would be to not take any action on this item for 6 months. We will continue to work with the Family Health Care Network, the City of Porterville, in order to, and also with the county officials, so that a plan for this transition is in place so that there's a smooth exit. Sierra View has just this week given all of our resources that we have at Sierra View for physician and professional recruitment to Porterville Family Health. Their recruiter will be meeting with ours this week so that we can formally introduce the Porterville Family Health Care Network recruiter personally to all of the individual recruiters that we have worked with over the years. So we open up a door with a lot of opportunities for Porterville Family Health. The issue is that it takes some time. Mr. Foster has stated to the Board of Supervisors that just from a bureaucratic standpoint, it probably would take at least 6 months in order for his facilities, a new facility, to become fully licensed, so forth and so on. It also will take us some time at Porterville, at Sierra View District Hospital, in order to facilitate and help Porterville Family Health to bring new physicians into the community in order to take care of these individuals. In the aforementioned discussion in regards to the OBGYN, 2 weeks ago, he met with me personally and did tell me that he was leaving the community. So we at Sierra View will be looking at recruiting an OBGYN very shortly. So just wanted to let you know. Very much.
Thank you, Mr. Coleman. Tom Velasquez.
Good morning. My name is Tom Velasquez. My address is 350 South Cassing. I'm a resident of Porterville, and I'm chairman of the Porterville Hispanic Coalition. I'm here on behalf of the coalition members who share a passion for helping those in the community who are less fortunate and need help. I'm also here today because of a concern we have in our community. The closing of one of our county health care clinics. We all realize this is a delicate and sensitive issue. Closing of this clinic will seriously impact our community, specifically those who are most vulnerable, the poor. County's plans to have those folks drive a considerable distance for doctor's visits and medical treatment, many of who do not have transportation. We feel because of this added distance, they will face many will end up in our hospital emergency rooms, or worse yet, fail to receive health care. I'm here today to ask for your help. I'm here today to ask that you give our community health care professionals, city officials, needed officials to formulate a plan to keep our clinic open and provide needed health care for our citizens. I realize you all faced with a difficult decision, one that you've wrestled with over recently, but I also realize you have a choice to do the right thing. Give our community leaders the needed time to develop a plan to keep our clinic open and to continue to provide health care for those in our community who need it. Thank you.
Thank you, Mr. Velasquez. Cam Hamilton? Doesn't say PhD, it says mayor.
It's correct. I don't have a PhD. Honorable Chairman, members of the board, appreciate the opportunity to come before you again on this beautiful day. I appreciate what you just did with the county roads. Steve, I know you needed 80 and 416. We're working on that. And the sheriff with sexual predators, but I'm here to tell you this is just as important as the decision you just made. We appeared before you in late March to express our opposition to the staff recommendation to close the Porterville Clinic. We have worked to find options to this direction. There have been much effort, some success, but very little time. Our recommendation is not to take any action on this item for 6 months, continue working with Family Health Care Network, and to require that the plan for this transition be in place before the county's Porterville Clinic is scheduled to close. We support the Dinuba City Council that similar basic accommodations be made to serve that community. Your leadership with this matter is critical because its presentation has been clumsy and apparently based on misconceptions and half-truths. For example, we're continually told that Porterville is scheduled for closure because it is losing the most money by your percentage criterion. In fact, Visalia is losing the most money at $4.9 million, which is $1.9 million more than Porterville's loss. This is profound because in budgets we don't add up percentages, but instead dollars. And the additional $1.9 million from a Visalia closure could do much good for the county. When a suggestion is made that the system should be reformed rather than portions amputated, there has been very little interest expressed in problem solving by the county. Instead, the trumpets played of the crisis, and the sound of the trumpet is that the board has no real options. If this matter has been managed, how can this be? Your staff indicates that they are meeting demands received from the healthcare sector to privatize, but there is no effort to privatize each of the clinics with a comprehensive plan and a multi-stage effort. We have an expectation of equal protection of the law, and such a comprehensive solution would reassure us that this is about budgets and not politically reallocating monies within the various areas of the county. Your staff indicates that your only obligation is to serve a limited constituency of indigent individuals within the definition of TCMS, but we read the requirements much differently. We understand that you are required to provide relief to those who do not qualify for any other relief, not only those that you have selected as indigent. We cannot understand how you can escape the requirements given the 2003 failed Los Angeles clinic closure. Fairly explicitly, your staff proposes to balance your budget on the back of other medical providers. Either the 5,000 patients who use the Porterville Clinic will lose their health care provider and be profoundly without options, or they will have to use the clinics and Sierra View District Hospital emergency room. This plan is explicitly cruel and will hammer facilities already reeling from demands on their services. With a crisis time frame and no explicit plan, the recommendation you are considering simply abandons services you have historically provided to those with the least political power and the most profound need. Instead, the county proposes to close these clinics without any open analysis as to the impact or coordination with affected entities concerning implementation of the decision. In short, it appears to many to be political, cruel, and illegal. There are answers, but there will take some time and constructive engagement. There must be a plan for solution for the entire problem, not only the limited budgetary crisis. The City of Porterville requests that no action be taken on this item for 6 months to continue working with Family Health Care Network, so a plan for transition is in place before the County Board of Supervisors schedules the Porterville Clinic's closure. And I might add that there's been talk that we would move this money into other mental health and all that, but $4 million in Visalia, $2.2 million in Tulare is obviously being funded with either mental health funds or other departmental things that we're talking about taking away from Porterville and Dinuba. We are in belief that you shouldn't be in the primary care. We're in agreement. What we're asking for is time that we put forth a plan that there is not individuals or medical providers that are going to suffer from this, as well as those that are using your facilities now. I thank you for your time.
Thank you, Mr. Hamilton. Felipe Martinez, Mayor Pro Tem.
Muy buenos días. Es un placer estar aquí enfrente de ustedes, principalmente porque la mayor parte de la comunidad no pueden entender lo que está pasando. Good morning. It's a pleasure to be here. Chairman Conway, Board of Supervisors, I want to give you, first of all, thanks for telling staff to go, direction of staff to going out and meeting with the communities, especially in the areas that are being affected. Second of all, when we met with staff, there was certain information that we requested from staff for us to follow through. We did not receive all the information. 3 weeks ago, you held this over. 2 weeks ago, we met as a collaborative unit between Family Health Care Network, Sierra View, and other agencies in our community. We were starting a formulation of a plan, but we need time to come up with a plan. A week ago, we met with staff from the Board of Supervisors along with Board Member Ennis, and we had a dialogue, and we were presenting certain criteria that we want to come into our meeting. We were invited to this meeting from Harry Foster, CEO of Family Health Care Network. We were not invited from the Board of Supervisors or from staff. The comment was made that it was a shame that not all the clinics were invited. Well, we weren't all invited either. We were just happened to be there because of the invitation. We have sat down for 2 weeks. We've looked at some numbers, came up with a formulation. We agree that you should get out of the clinics, in all the clinics, not just the 2. We also believe that the monies that are being saved is really a ludicrous statement because you will be losing money no matter what. You save $1.5 million, but yet you're going to lose another $4 million? That's not saving. And we agree with you that your primary concern should be to the benefit of the community, providing the inoculations, providing the benefits. We agree with you. But we're asking you to partner up with us, along with the other cities, to formulate a plan. You're right, Mr. Worthley, nobody likes change. But guess what? We're all in favor of progress. And to progress, sometimes you have to slow down and implement the plan to come up with a resolution for all involved. And the reason I chose to address you primarily in Spanish first was to let you know that there's a constituency out there that doesn't understand what's going on. I want to thank you for the opportunity, and I want to ask you one more time to refocus and give us 6 months to look at it, to partner with you, and come up with a resolution together, because your constituents in the whole county are partly our constituents in the different cities that we represent. Thank you very much.
Thank you, Mr. Martinez. Odie Corneliuson. I believe you have, ma'am.
Name's Odie Corneliuson. I live in Strathmore. And the last time you were here with me, I was saying, do not close my clinic. Well, I was also told by someone up there that that clinic didn't necessarily have to be closed, that maybe redone somehow so you can save all this money that we're losing. I'm here to tell you, don't close that clinic. You're talking about saving money, and I have to save too. But the whole truth of it is, we're going to be hurting families. We're going to be hurting older people. All of those people that those clinics have been taken care of are going to be hurting. I would dread going to a doctor if I had to take 2, 3 kids with me and climb on a bus to get to Visalia, to get to Tulare, you know, for treatment. Have you ever been around a poor, frustrated mother that's hanging on to children, trying to keep them under control? They sit for an hour, 2 hours in the waiting room, and those children are getting hungry, they're getting tired, they need a nap, and they're still waiting. Well, this is what we're used to. We're used to waiting. But on the other side of that door, when we're called in, we're seeing some people back there that care, that are good at their jobs. Our doctors are very good. I don't want to lose my doctors. If they were transferred within a reasonable distance from where they're at now to some other clinic, that would be okay with me personally. But please, you know, don't tell us you're going to cut back, not necessarily close, and now all of a sudden everybody that's speaking up here today is closing it. I, for one, don't agree. I can't get a bus to my house to take me to the clinic. I have to rely on some neighbors that are good enough to take care of me. I have a sister that loans me her car once in a while. But yet, as you see the way I have to get up out of a chair, it's next to embarrassment. But I hope it makes you see I can't even walk down my driveway. What I'm trying to say is, don't hurt us. You're hurting a lot of people. And I can see just babies constantly having to be drugged for they're away from home and can't get back to give them their naps. Don't close us. You're hurting us all. Thank you.
Thank you. That was all the cards I had. Is there anybody that we missed that wants to speak?
Good morning, Chairwoman Conway and Supervisors. My name is Donette Silva Carter. I serve as the President and CEO of the Porterville Chamber of Commerce, which is located at 93 North Main Street in Porterville. Our chamber has 550 members, representing over 13,000 individuals employed at those entities. We continue to oppose the closure of the clinic. However, we're starting to see the handwriting on the wall. And so today I'm here to speak in behalf of extending the time for 6 months so that a proper plan can be put into place for a transition that will work. I think it's very exciting, as does the Chamber, to see an entity that has existed for 30 years in providing quality health care services again step up the plate to actually add to those services and want to take on the monumental, they say it right, challenge of adding several thousand patients to their care. That entity, however, does require the additional amount of time the whole community does in order to make a smooth transition. I think it's exciting to see that we have an opportunity out of a very negative situation, which this is, to create a more winning situation where our residents who require this care can have that care transferred. In most cases, they're going to maintain the same practitioners. They're going to have the confidence of knowing that they will have a quality care provider who's been in business for 30 years overseeing that care. We have the opportunity in Porterville, although we do not agree with the closure of the clinic, and we stand steadfast in our disagreement with this situation, but we do have the opportunity to help the county resolve this problem, but we need your assistance in order to do that. All we're asking for is 4 additional months into next fiscal year for you to assist with financially keeping the clinic open. I think it's sad to see that 2 years ago we were celebrating the opening of this new clinic. I don't know what type of planning or lack of planning went into us proceeding with this, but let's not continue on that same path and create such a negative situation in our community. The Porterville Chamber of Commerce kindly requests an extension of time so that we can make a proper transition of services in our county and in our community. Thank you.
Thank you, Mrs. Carter. Okay, Board.
I have one question for Ray, if I may. Simple question, Ray, the timeline, timing. We've heard requests for 6 additional months. Part of your presentation talks about a 4-month, after a 60-day notice, a 4-month team effort to switch things over. How much time are we really talking about here?
In my recommendation, the actual physical services would be suspended July 1st, and that 4 months would be an operation offsite to basically manage those medical records and the transition if people opted to contact us and they at that point had made up a decision where they wanted to have their care taken or moved to.
So that part of the work would not take place there at that clinic?
No.
That would be done off-site?
Correct.
Okay.
That 4-month period. So that's the way I've envisioned it as part of my recommendation.
I have a lot of thoughts, a lot of emotions about this. I think one of the bottom lines, it's interesting to me that there's so many different perceptions of medical care and how it works and how it functions. Part of, even from a county perspective, these dollars are all, whether it's federal, whether it's state, whatever it is, it's local tax dollars. So when you talk about the county, that includes everybody in this room. We are all members of the county.
All taxpayers.
And we're, yes, most all of us are taxpayers, and that's what really funds this. So it's a difficult situation any way you look at it. I mean, in my own mind, and I'm not trying to ramble here, as you guys know that I do, but it's how I work things out. You have the family care clinic, if you will, as medical health. First of all, I don't see any of these as economic drivers. So when we talk about losing something, I hope we're not looking at it as losing some kind of economic driver, because no matter what you talk about, that's not what this is. And we are somewhat limited by the dollars. It's our own tax dollars, but yet the state has a say in where those go and how we use them, as does the federal government. So when we talk about the FQHCs or the federally qualified health clinics, that it's my understanding of an FQHC that they receive better, quicker, faster reimbursement for services with federal dollars than you would necessarily with local dollars. A better way of doing it. I often brag that in the community of Tulare, where I live, that the community clinic there, the doctors that work on staff at the clinic are the same doctors in the community. So my doctor, my family doctor, sees the patients at the clinic. So there's no tiered health care, if you will. In other words, I'm able to see my doctor because I have health insurance, but that same doctor works at the clinic and sees those who have nothing. So we are in this together, and sometimes it's just a matter of semantics. When I look at the dollars spent, it's on the family care clinics, and I will also tell you that I'm a big believer that government isn't always the best supplier of services. I think that's obvious. I mean, if you look at the community of Dinuba, when, according to my understanding, at one time we were the only family health care clinic, not your brand name, Mr. Foster, family service clinic for medical care of delivery, and now there are 8, 9, 10, however many. If people think that reflects bad on us, I would just say that government is not always the best provider of services. Obviously, the private nonprofit sector in the county is doing a very good job, a valiant job, and people are aware of that because they're seeking medical care from these clinics. On the other hand, we have public health dollars. We have mental health dollars. I guess that's all comes onto the subdivision of what money is appropriated to this county for health care, whether it be in a clinic, whether it be in public health, whether it be in mental health. So obviously we're looking to serve the community in the best way that we can with the dollars that we have when you blend them all together. We heard last time from those in mental health that said don't use mental health dollars to subsidize these physical care clinics, and which is more impactful. I mean, if we're using the health dollars that we have on a clinic and taking away dollars from public health issues, whether that's immunization or the stories that we heard this morning, or mental health, which I would represent to, especially those of you in city government, is tremendously impactful on your city government, whether it's your law enforcement or whether it's, we all have issues with homelessness and all that goes along with that, impactful dollars. People have convinced me, when I first became a member of this board, did not believe that the mental health was so impactful to a community. I've probably done a 360-degree turn on that. That was my perception as a person in the general public. Now, with 6+ years serving on this board, am seeing more clearly the impact of mental health and the way we treat it and the way we handle it. So I'm not enamored with losing, that some of the dollars that could go to mental health are now over here. So I guess we have to look at it as a total system. I mean, it's the health care system, and that's what we're challenged with. We're challenged with X amount of dollars, and how do we make the best effective use of that? How do we serve those that we serve, which is every member of the county, and realizing that these are tax dollars, and they're also limited. We don't have unlimited money so that we can be all things to all people and be what people believe we need to be to them. There was no question in that. I don't even know that there was a statement, just kind of expressing my feelings on the dilemma that I believe we find ourselves in. And I use the term we loosely because we are the Board of Supervisors that will be helping make this decision, but obviously we are in partnership with every member of the community, those that have come here to speak today and those that haven't. Certainly our staff that looks at this and works with us and does this on a daily basis in all aspects of health care, the private not-for-profits that are represented here that work as we do. with tax dollars in providing medical care for those that are in need. So as you leaned in, Supervisor Woodley, I was wondering if you're going to comment on my ramblings. And I went over my own 3 minutes probably, so I'll be quiet now. And back to the board for further discussion. I know it's also on our closed session agenda. It's not.
No, we're not on closed session. However, on our agenda
We're not
today,
still under threat of litigation.
Well, I was going to say that based upon the record before you and upon what we've heard today, I believe that I can advise you that you probably do face a significant exposure to litigation against the county on this matter. I would recommend that the board vote to see if that is their opinion also. If it is, then we can't go into closed session.
Okay. Well.
The threat of litigation is in the 9th paragraph of the letter from McCormick, Cabot, Jenner, Blue, if you didn't know.
Okay.
You want to go in closed session?
I don't need to.
You don't need to? Well,
Madam Chairman, there was a comment made about doing the right thing, and I think that is really my focus, which is what is the right thing. And I want to commend our staff because challenging the status quo is never an easy thing. So the way things are the way things are. And it's easy to try to keep those things propped up and keep going that way. But through the concept, really, that was championed by you, Madam Chairman, of a business plan for the county in terms of really evaluating ourselves and how do we conduct ourselves. Are we doing things in a business-like manner? Are we doing things which are our core responsibilities? Because sometimes we tend to kind of drift. Over time, we sort of drift. And when you think about why the clinics were established with the closing of the county hospital, there was a specific need at that time. Fast forward now, 25, 26 years later, it's appropriate for us to evaluate where are we today. Is that need still the same? It appears to me that we have two different issues. One in Porterville is an issue of capacity, perhaps, and that's why the need for some additional time to make the transition. I don't agree with the idea that we would delay action today. I think we would simply establish a time certain when we would close those, which would be 4 months beyond our expected closure now, which would give you the 6 months if that's the appropriate length of time. That's not been the claim in Dinuba. Dinuba has not claimed that there was a lack of capacity. So the delay beyond July 1 would not seem to be necessary. But I think the right thing for us to do is to do the right thing, and that is to put the money where it's intended, especially when we see that there is a need. I agree with Ms. Conway that when you look at mental health, it is an area that is very underserved. And you look at Dinuba with all of our health clinics, when you look at mental health, then you find there's a large void. So the county does have a responsibility. We have resources that are allocated for mental health. We have responsibility to perform those services. And we've been taking those monies from mental health in part to help pay for the maintenance of the physical health facilities. Likewise with public health. And so I think it's time to put the money back to the core responsibilities that the county has. And that means that we have to move forward, and it is painful to do that. I can appreciate the fact that the cities are here and asking, please don't close the clinics, although I did hear two different messages in Porterville. One of them was, we think you should not be in the business, we just want more time. So I guess we're on the same page with them. But I do think that ultimately this is the right thing for us to do. And a comment was made about other clinics. Well, this is the process. This is not like we make a decision today and then we're foreclosed from looking at other options in the future. I think this is part of what government needs to do, is continually re-examine itself to say, are we doing our core responsibilities? How well are we doing? Can we make improvements? It may be very well that we do ultimately get out of the clinic business completely in Tulare County, if that's the appropriate thing for us to do. But every step begins with its first, every journey begins with its first step. That's what we're dealing with here today. And so in spite of the objections, which I think are understood, and I think Ms. Conway made the comment that people have different perspectives, I can appreciate that. But as a decision maker, policy maker, I believe that it's the responsible thing for us to do to proceed with the requested action by our staff.
Well, I appreciate the partners that were here this morning so that we have an understanding of their process. That would be Mr. Foster and Dr. Tusu. And if there's others out there that I've missed, I apologize, but who want to work in conjunction, want to work in partnership. It's not the intention to leave anybody out. Transportation is an issue, or whatever those issues are. I mean, I seem to remember a few years back in our Council of Governments conversation, there was some issue in Porterville about not enough bus transportation to the private non-for-profit clinics, and I believe we did our best to rectify that. The fact that our transportation dollars were held up until we did something about it probably is incidental to that conversation. But that being said, I don't think it's the intention of anybody to take anything away or not provide. Obviously, I want to provide in the best way I can. If the county clinic is not the best way, if people are better served by the private nonprofits, I guess I'm ready to work with them and make that decision. If there's a question of time, I mean, the clock has already started ticking. It sounds like there's been ongoing dialogue, and there's sharing of information and services, and looking forward to that. I mean, I realize that we have to do something, so I haven't heard from the other two supervisors, but Supervisor Worthley, are you proposing that we do something with a time limit, or Supervisor Innes, please?
Well, I too have to commend the staff for this clinic had to be in trouble almost from its conception. And for you guys to juggle resources like you have over the years has been commendable. We do have half of that clinic is our mental health clinic in Porterville, which is desperately needed, and we can't continue to take money from mental health to keep the other one going. But I do feel that we were a little bit short when we came up with a timeline without allowing the city of Porterville more time to evaluate the situation and prepare themselves for the closure. So that's the thing that bothers me about the whole situation. I think we need to extend that time for Porterville so that they can better get their resources put together and hopefully pick up the slack when we do close the clinic.
Madam Chair, I have a question for Supervisor Innes then. How are you going to pay for that?
Well, we'll just continue.
I mean, are you proposing that we transfer monies from mental health to subsidize that? Are you suggesting we use a general fund transfer?
Well, I was just trying to suggest to Health and Human Services what they could do and help us in the situation since they were so short with the time limit they gave us in closure.
If I can make my 1 minute statement.
I'll give you three.
Three. You know,
Don't go away, Ray.
You know, we've been talking about this for a while, and there's been some things said that I take exception to, that we're targeting out these two areas, when in fact we know the entire system is being looked at and observed. So I take exception that people think we're just targeting them out, that we're not looking at this entire system overall, when in fact we are, that there have been misconceptions and half-truths spoken. I do not agree with that. I think the county has been very open and forthcoming about this. I appreciate staff for going out and meeting with the people at the clinics, with the cities, who were actually not able to do so until they received the direction from this board to do so. They couldn't have gone out 4 months ago or 6 months ago and started those meetings without first informing the board and then having the direction from the board to do so. So I take exception to a few things that were said, and I don't agree with the idea of extending the time limit. I will not support a transfer from mental health funds. The city of Dinuba themselves said that there was mental health issues, and to support that is just not within my understanding why we would take money from mental health that has the problems that it has and support another system that has the problems that it has. So I'm in support of staff's recommendation number 3, and I'll leave it at that.
I'm sure I would be interested in the staff's response to Mr. Ennis's question about if we were to extend it, how would it be funded?
I've given that some thought, because even though I wasn't able to participate in the meeting with folks down in Porterville, I heard that was basically, if you will, a counter proposal. So I've attempted to quantify what that might mean in terms of real dollars. I believe that if we get a decision today, rather than just delaying a decision, I think that's going to set in motion a number of things that could potentially curtail the cost. In other words, if you start making some transition of patients to other providers early on, we could maybe move some of those staff. And so it wouldn't necessarily be, if you extend, say, for 3 months, you wouldn't be able to say that would cost you 1/4. I think it would be something less than that 1/4 of the $1.5 million that we're projecting to save. But the real meat of the question is what Supervisor Cox has gotten to. How are you going to cover, even if it's a $250,000 to $300,000 additional cost by keeping that open? What's that going to mean? And at this point, I'm hearing very loud and clear, and I've heard from my counterpart, Dr. Dirksen, in mental health, that don't anticipate any additional dollars, because they're going to be looking at some very, very tight budget constraints coming into the 07-08. So the likelihood of getting any money from mental health without reductions is nil to slim. So I'm saying that you're probably going to be looking at either general fund commitment or maybe working some other magic over in the social services side. But I'm even hearing that the social services side has, due to the other shortfalls that the state is experiencing with their LAO projections and the May revise, that don't anticipate any additional funding coming in over there. So in all seriousness, in answer to that question, we'd probably be submitting a budget that would include some additional general fund.
And it sounds like, Madam Chair, it sounds like we've robbed Peter to pay Paul so many times. Peter is without a dime.
Mr. Bullock, I mean, I'm semi-encouraged by some of the conversation this morning. We're looking at 2.5 months. You know, is that an adequacy of time? Are we able to make a decision? Let's ask this question. Can we make a decision this morning, working diligently on all the things we said we're going to make to try and make our July deadline? But if it's not happening quickly enough, if we're not able to take care of folks, if we don't find places for them, are you able to come back to us and say this isn't working?
I think I stand with my comment 3 weeks ago when you pushed the hearing back. I think today is our drop dead if we're ever going to make a July 1, and it's compacted to make a July 1 closure. And so I think if we have direction today, I would be more comfortable with having some direction that gives me definitive dates rather than ASAP, because I'm looking over at the attorneys here, and that's probably not fair, but I think one of the things that we need to do is stipulate time-specific closures, and that will also have to be part of our notice that we send out in that letter, is the time-specific and the dates that we had the Bielensons, et cetera. So I'd be looking for some guidance with dates if that's the direction our board goes.
Madam Chair,
yes.
if I can, I'm not inclined to stretch this out, so I would, hoping we get a second here, make the motion that we adopt the recommendation number 3, which is present a budget reflecting project cost savings generated through clinic closures, Dinuba and Porterville, and direct the following actions, A through D, as recommended by staff.
Which should be the closure by July 1.
Correct.
Also, I believe that we've provided you with a draft resolution that you may want to use specifically toward the closures, which would indicate a date. That would have been separate from your actual agenda materials.
Have that. I believe we have it. Do you have it, Phil?
Okay, this would, my motion would include the resolution as proposed by County Council, items 1 through 9.
And you will need to fill in dates for the closures.
Well, as stated, July 1, 07 for both 9A and B.
I'll second the motion for purposes of discussion, because I know that I'm sure Mr. Ennis would like to enter into the conversation about the extension of time. I think, honestly, I thought that extending it for a couple of months would not be a big issue. But what I'm hearing this morning is it's a bigger issue than I think I thought it was going to be. I'm very concerned about taking general fund dollars to fund this. I was hoping we'd be able to rob Peter one more time to pay Paul. But if Peter's been decimated, and so we're now at the point where the only option would be to take general fund dollars to fund this, then I'm more concerned about that extension of time. And one thing I do want to point out is I appreciate Mr. Foster's comments, but we recognize that Mr. Foster is not the only provider of services in Porterville, that other services providers have indicated that they do have additional capacity. There was mentioned OBGYN and so forth. So it's not like everything has to fall to Family Health Care Network. There are other providers in the community that could step up. And again, these people will have the opportunity to go where they want to go, and there will be other options for them. So that is a concern that I have that previously coming to this meeting I did not think would be a huge problem. But I see it today to be more of an obstacle than I would have anticipated.
Well, I wasn't against closing the clinics, but I did feel we needed more time in the Porterville area, and that was what I was stressing. And I still stress that, and that's my stand this morning. We do need more time. But I speak as one voice, so.
Then I guess I go, well, I'm back to my original. If we take this motion this morning with our goal of being July 1, and we tell everybody that we're going to do this by July 1, and we start contacting the patients, if somehow we realize on June 1 that we're not quite there, is there an opportunity to?
Madam Chairman,
Or is there anything we can do with
the
that?
issue, everybody talks about a plan. There is a plan.
I understand.
The only real issue is whether there's sufficient capacity in that community, and that is if the county closes the clinics by July 1, will we leave people without being able to be, their needs being met by the existing capacity within the community?
And of
To me,
course,
that's the whole issue.
and of course, you know, that's my concern.
That's the whole issue. Mr. Foster has testified that from the standpoint of his particular business, he needs additional time to be able to process various licenses and so forth. He thinks it will take him 6 months to do that. And I'm not arguing with him. That may be very well true. That is not to say that there aren't other opportunities for people to go to other clinics, or that he might be able to absorb some of those numbers into his clinic as it now stands and still process that with the idea of expansion. So, again, I'm very concerned about the idea that we take general fund dollars to fund this, and because as I hear it today, that's really what we're down to. If we don't use general fund dollars to fund this continuance, then there's no other place for the money to come from.
Okay. My denial needs to end. So we have a motion and a second. Any further discussion? If not, everybody clearly understands the motion and the second? If so, then cast your votes. Okay.
Better announce it.
The motion is, it's 3-1. Was this a fourth, fifth votes needed?
No.
No. Right, then the motion passes on a vote of 3-1. Thank you all for your attendance this morning. We still want to work with you. Still will be working with you. Okay.
You bet. Take care.
If I can. Thanks for coming. Okay. We're a little past our 11 a.m. timed item, which is item number 3 on the agenda.
Chair. You bet.
Dr. Mayor. Sorry, I don't need that today. I don't need that anyway, thank you.
Your turn.
The photographer, that one guy right there, this stuff, did you see that? I'm doing good.
Oh, good. Take care. Good to see you.
My first day back as chairman, and I'm losing control. Violated one of the safety rules that we heard about last week. All right. Moving right along to agenda item 3, which is an 11 a.m. timed item, and so at least I didn't start early.
Good morning, Madam Chair, members of the board, Mr. Haddix. My name is Lynn Gregory. I'm with the County Administrator's Office, and I'm here to talk about community choice aggregation. I want to begin by providing you with a short overview, a basic overview of what community choice aggregation is. It was created in California by Assembly Bill 117 in 2002. And what it does is essentially it allows California cities and counties or groups of cities and counties to supply electricity to customers within their borders. Investor-owned utilities, according to the bill, are compelled by law to support and assist the establishment of community choice aggregation programs. And local IOUs will continue to deliver, meter, bill, and perform the customer service just as they do today. Community choice aggregation is relatively new to California. There have only been 3 states in the nation that have actually passed community choice aggregation laws. Northern Ohio has made the most progress, and their largest community choice aggregation program is the Northeast Ohio Public Energy Council, and they are currently offering a rate of 4 to 6% savings to the customers in their area. A community choice aggregation program is not the same as a municipal utility. A municipal utility owns the transmission and delivery systems, and a community choice aggregation program is responsible for the energy commodity, which may or may not entail the ownership of electric generating resources. There are several items that are of value to forming a community choice aggregation program. First, it provides a mechanism for utilities to utilize local renewable energy resources such as gas derived from dairy waste. Its rate decisions for classes of customers are made across the IOU's territory. So the thought is that if you have a local territory, you're going to have a local rate. Lower rates could attract new business and new economic development in an area, and there's the advantage of lower rates themselves. San Joaquin Valley Power Authority consists of 13 members. Those members are from the city of Clovis, Corcoran, Dinuba, Fresno, Hanford, Kerman, Kingsburg, Lemoore, Parlier, Reedley, Sanger, Selma, and Kings County. The Power Authority is governed by a board of directors consisting of 1 director from each member city. They signed an agreement, a joint powers agreement in November of 2006, and have submitted an implementation plan to the California Public Utilities Commission in January of 2007. Kings River Conservation District will be the energy service provider for the program, and they are building a 500 megawatt gas-fired power plant, which will begin operation in 2010. Citigroup Energy has been selected as the energy supplier for the program. They're one of the largest financial firms in the world. Citigroup has a market cap of $260 billion, and they got into the energy business approximately 28 years ago with Philbro, but then formed Citigroup Energy in 2003. How does the CCA work for the average customer? A customer is automatically enrolled once the community choice aggregation program is established. It's important to note for the county that this would be available only to those constituents living in the unincorporated portions of the county. A customer can then opt out of the program within 60 days at no cost. They will receive 4 notices in their billing cycles, 2 prior to the implementation and 2 subsequent to after the program has been initiated, notifying them of the opt-out opportunity. Customers can opt out either in writing or by calling a toll-free number. After the 60-day period, a customer can opt out, but they will have to pay exit fees. The exit fee may be imposed to cover any financial commitment the local aggregator has made to the power supplier. The benefits to Tulare County and its constituents: San Joaquin Valley Power Authority has estimated they will offer a 5% reduction in rates to constituents located in the unincorporated portions of the county. The total estimated cost savings is $13.8 million through 2010. The county itself does not have many buildings located within the unincorporated areas. Tulare County has a total of 651 owned and leased buildings in total, and 58 of those are located in the unincorporated areas. So only 9% of the county buildings will be eligible to participate in the program. However, the street and signal lights would fall in the unincorporated areas, would fall into the program, and we pay the most per kilowatt for street lighting currently in our electrical bills. Another advantage to joining now as opposed to later is that there will be a significant change in cost responsibility surcharges that will be charged by the IOUs after the first half of the year. According to the CPCU rules, the exit fee depends upon the year in which the commitment is made to offer community choice aggregation. Our date is June 30th, 2007. We must become a member and offer community choice aggregation, or we will then be no longer able to adhere to the vintage exit fees, which could result in a $2 million difference through 2010. As you're aware, San Joaquin Valley Power Authority did complete a feasibility report. The findings were that, again, they estimate a 5% cost savings to the customer. The impact of Tulare County on San Joaquin Valley Power Authority is that we will increase the size of the Power Authority overall by 20%. SCE territory which is Southern California Edison territory, will increase by 15%, and the Tulare County voting share will be 14.31, which is the second largest voting member in the program behind the city of Fresno. As you're aware, on April 10th, we came before your board and asked permission to approach San Joaquin Valley Power Authority to ask them to outline the terms and conditions under which Tulare County might become a member of the Power Authority. On April 12th, they held a board meeting, and a vote was held to outline those terms and conditions. There were 3 terms set forth by the Power Authority. The first was that Tulare County must pay $20,500 must be paid for an energy assessment. This was approved by your board on December 5th, 2006, and has been paid. Tulare County cost share is the same as the original 13 members. The cost share assigned to each member is based on their voting share percentage. Our voting share percentage of the initial cost is 14.31% of a $50,000 startup cost, which is $7,155. And the inclusion of Tulare County and San Joaquin Valley Power Authority does not impact the implementation timing and initial rates for the original 13 members. If you were to approve us becoming a member of San Joaquin Valley Power Authority today, where does that put us? It basically puts us, in relation to the other Power Authority members, we would be on the same playing field at that point. We would be at the same point the remainder of the Power Authority members are currently. The next steps for Tulare County and the Power Authority are: first, we must agree to the terms and conditions as set forth by the Power Authority. San Joaquin Valley Power Authority must submit a modification to its implementation plan with the California Public Utilities Commission. The California Public Utilities Commission must certify the modified implementation plan, including the Tulare County data. San Joaquin Valley Power Authority's board must approve project agreement number 1 and the power of service agreement with KRCD. Tulare County and the San Joaquin Valley Power Authority members must pass the project agreement number 1, and at that point we would be, this is your final off-ramp, so to speak, if you choose not to participate in the program. And then a binding notice of intent for the San Joaquin Valley Power Authority's program would be sent to the investor-owned utilities. San Joaquin Valley Power Authority Board will finalize the program rates. Notices will be sent to San Joaquin Valley Power Authority members for their own account to determine if they will opt out of the program. And then service will begin in November 1st of 2007. The request before your board today is that I have added some additional items. First, that you introduce and waive the reading of an uncodified ordinance adding subsection S, which in the agenda item it actually lists T, to section 105, so that is a revised request. That you approve the ordinance summary and direct the clerk of the board to publish it. That you waive the second reading and adopt an ordinance on May 1st of 2007. That you authorize the chairman to execute the JPA on June 1st when the ordinance goes into effect. And then one additional request has been added, that you authorize a payment of $7,155 to San Joaquin Valley Power Authority for Tulare County's 14.31% share. If you have any questions or would like to discuss the feasibility study in greater detail, members from both investor-owned utilities, which is Pacific Gas and Electric, Southern California Edison, as well as KRCD, are here and available to answer any questions you may have. And also there are some additional handouts that she's going to pass out.
Chairman, I've also included for each of you a question and answer that people often ask regarding.
Getting it again.
And you're getting it right now. Anyway, it's a 9-page kind of gee whiz question and answer flip through from everything of what's provided, what's the cost to join, what's the cost if the board later down the road wishes to opt out of the JPA, all the aspects there.
Madam Chairman, if I may make one comment, the request to approve the $7,000+ was not agendized. Unless it's urgent that we do it at this meeting, you may want to take that at the next meeting where you actually adopt the ordinance. I'll defer to the CAO if there's grounds for taking it up at this time.
Not a problem to take it at the next meeting.
Council? Glad you're here. Basically, I'm going to look back at the board and just see if there was any more questions for Ms. Gregory.
One quick one. I notice our opt-out, everyday common customer, what's their opt-out fee? Let's say they missed the 60-day
It's the 60-day opt-out.
Well, and there's a fee, a nominal fee. What's the possible fee they have to pay to opt out if they forget to check the opt-out box? And
I'm going to defer that question to David Orth from KRC.
And Supervisor, while Mr. Orth comes to the podium, there are 4 different off-ramps, as you heard stated, to opt out. The first 2 come before bills arrive, just notification. The third one comes after the first bill arrives, and the fourth one comes after the second bill arrives, so that a customer ideally would be able to view, compare and contrast. And then the opt-out can be done through 2 mechanisms. One, either written notice, or second, calling a toll-free number.
Well, a lot of customers like me, though, they get the bill, they rip off the bottom part, write the check, and stuff in an envelope.
And throw that other stuff in
And throw the other stuff in the trash.
Then there's customers like me that have auto pay and don't even open the bill. I just admitted that in public.
In response to your question, during the initial notice and opt-out period, there will be no exit obligation to a customer. So if they receive notice, and we do intend to mail direct mailings to all customers so that we can surpass the habit that we all have of either auto pay or just paying the bill and throwing everything else away. We want to do direct mailings so that people are effectively noticed. But during that initial noticing period, there are no exit obligations. If somebody chooses to exit after the initial cutover, say in year 2 or 3, they decide that they don't like the program and they're going to leave, The implementation plan that's on file with the Public Utilities Commission provides for two components of cost. One is an administrative charge. Residential customer is going to receive a $25 admin fee to process that departure. And the second piece would be an adjustment to market, very similar to what the utilities are doing for their exit fees, where our board, the authority board, will annually look at the value of the power that's been purchased to serve that customer and what its value is in the marketplace, and the differential would be the cost component that that individual customer would have to pay. We have not tried to quantify that at this point.
Wow, you got to put that in English for me.
Well, yeah, sorry. It's, you know, we tried to follow the simple approach that the utilities use. It's the value of the power that we've purchased for you in the marketplace versus what you've committed to pay for it. The differential is what you as a customer would have to pay.
At the most, $25?
No, that's the admin.
That's the admin fee
$25 plus an amount to be determined annually by the board.
And since this is kind of new throughout the world here, there's not a history to know what that might be.
We can do rate forecasting. At this point, we have not tried, but you're correct to some degree. There isn't a good basis of information based on experience to quantify.
My concern is someone gets a bill for $25 and $1,000.
Residential customer?
Because I'm one of the who's the guy that's got all the, I probably got the largest electricity bill of anybody here, but I'm one of those guys that thinks, wow, if I'm going to get hit with 10%, that's going to be a lot of money.
Though if I could interject, Supervisor, if I'm not mistaken, there are 4 phases of which this is ramped in. Phase 1, I believe, is residential. But as you work through the various phases, the latter phases include the bigger users. And so one would anticipate that by the time the more industrial customers come online, they'll have better sense of what's going on because the residential and others have already been actively participating or chosen to opt out of the program. Am I correct in that?
Yes.
Okay.
Let me try this a different way, because I understand your concerns. There's 2 points. Number one, we have to provide you with some type of exit fee cost exposure before you make your final decision. And again, as I reported last week, there's a series of decisions that have to be made here, and this is just the second in 3 steps. Step 3, which will come to you under current schedule in late June, will provide you with some information to assess what the exit fee obligation or exposure might be. That's one thing. The second thing is, if you consider that in California, energy prices have done nothing but increase for the last several decades. We have not seen rates miraculously drop off. And I would like to say that we may expect that in the future, but the reality is we shouldn't expect that. If we lock in lower cost rates over the next couple of years, committed to serve you as an individual customer, and then after year 3 or 4, you just don't like the service, theoretically, the value of that power in an increasing rate market will be greater in the marketplace than you committed to pay for it. This is the model that PG&E's exit fees are showing for 2006 and 2007, where their adjustment to market is actually a negative. And if we continue to see that economic pattern in the marketplace, then there shouldn't be an additional charge beyond the $25. But we'll show you some rate sensitivity and let you assess. If you think rates are going to drop 10% over the next 10 years, then here's the obligation.
Follow up with that. The fee is based upon that differential for what time period? 1 month, 1 year? What's the? In other words, I opt out. I mean, I'm in this thing for life, essentially. I opt out today. I don't have to pay that differential into some future date 10 years from now.
We have not yet figured out specifically how that fee will be calculated or collected. It's been a conceptual formula that was placed in the implementation plan. So it would be premature for me to tell you what the authority board has elected to do, because they just haven't with respect to that rate. I mean, in theory, it's supposed to represent the total difference between the cost that we've committed to you at the time you left the program versus what the value of that power is in the marketplace. Again, exactly how the utilities calculate it when you leave them and come to us.
Get that? You can explain it
A
to me
little bit of
later.
an unknown.
Okay.
Maybe, I don't know, is that a better answer? That probably would have been more forthright. Yeah, I don't know.
Okay. Well, any more questions from board? Well, then I know there's
Well, we do have.
Folks that wanna speak.
We do have folks that do have exit fees. Maybe they can,
yes, I was getting to them.
okay, if they can tell us what one of their exit fee is. it might
I
give us an
understand
idea.
there's folks that would like to speak to us this morning, and so they did not fill out the little cards because we didn't request them to. So I'll just go in the order that they're sitting. Mr. Schmidt, that makes you first.
Thank you, Madam Chair.
For the moment, yes.
For the moment, and members of the Board of Supervisors. I was sitting in the back for probably an hour and a half listening to some of the concerns of your constituents, healthcare issues. I mean, you folks have to battle with these life-altering decisions every time you sit up there. And this probably does not rise to that type of level. Let's be honest about it, okay? We're not talking about that much compared to what we are listening to with health care and mental health care and all that, and all the counties that struggle with that throughout the San Joaquin Valley. Our concern with this particular proposal is that there are a lot of unanswered questions. As Mr. Orth said, this is new. They don't have the answers to that. And if you're asking me what our exit fees is, sorry, I couldn't tell you what ours are. That's not my job. That's not what I do for the company. I just want to set the record straight on that. Our concern overall is that I was listening to a commercial the other day on TV, and it was about investment. And it said risk versus gain. And you've got risk here. Not a huge amount of risk, but you do have some exposure here versus your gain. Now, your decision here today and going forward basically is going to balance on that scale. If you think the risk is worth the gain, then that's fine. Then you need to vote in favor of it. But if you think that the risk does not outweigh the gain, then I think you need to not support this. I think there's a lot of unanswered questions. I think we've provided you with those last time we were here. That, in our mind, is significant enough questions that I think if I were sitting in your shoes, I would probably not support it. That's all I have to say. Thank you for the opportunity.
Thank you. Okay, row two.
Sarah will be last.
Mr. Delane, and forgive me, sir, I forget you were here at the last
Madam
meeting.
Chair, I've been called a lot of things. Row two is a first.
That's the old school teacher in me. I'm sorry.
No problem. Good morning again, or almost afternoon. My name is Charlie Wilson. I was with you a couple of weeks ago. Thank you for having me back. It's a lovely time to be in the Valley. Two comments, I guess, that I would share with you, or maybe three, just on the proposal. We received a copy of the feasibility analysis. I think they became available yesterday. So we have been doing our very detailed analysis in our 24-hour window. Two things, actually, I wanted to share with you just as questions, not so much as an opinion, and an area that we think would be important for some additional review and a request of you whether you'd like our assistance in doing that. One is that on page 11 of the analysis, it talks about the weighted average and this issue about the 5% discount that is contemplated with the JPA. In our conversations with the staff, the consultant who's been helping do the financial analysis, we get a different interpretation of the exposure there. And based upon the conversations we have had, there is the potential, unless we have missed something in our discussions, that you actually might have a percentage of customers that could actually see a rate increase. And we just simply want to understand when you're starting to do weighted averages, combining Edison customers and PG&E customers and coming up with kind of homogenized numbers in the middle, it's a little difficult for us to do an apples-to-apples comparison. And so my question of the board would be whether or not you would find it of use before you make a final determination for us to actually do some very specific customer-to-customer comparison through a variety of rate classes to see what that actually comes out to. Because, I thought that might be of some value to you, but I don't want to do that analysis. Jim had not volunteered to do that analysis unless it was of benefit to you. So I asked that and sort of leave that as an open question. The second, which I think was an important item that is pointed out in the feasibility analysis on page 13 about power procurement, the needs for the power procurement, and the specific impact that Tulare County would have on the plan as it's currently filed. As we did some very quick math, even with the development of a 500 megawatt power plant, with the addition of Tulare County, the number of customers and the load requirements that go with that clearly exceeds by some measure that 500 megawatt plant. And while there is within the portfolio options we discussed last time, there's going to be additional power that has to be procured. They admit, and that's another detail that still needs to be worked out as to what those additional requirements would be if your customers became part of the JPA and what then the specific cost impacts would be for that. Again, to do in general kind of homogenized overviews becomes difficult in that the devil is in the detail with this particular business. So my request would be if you can get as detailed with that as you can. Another question that I would raise, it was mentioned, and it just dawned on me this morning, that this was being presented as a potential tool for your economic development. I guess the question I would ask, because I did not see in the analysis, is whether or not your economic development experts have provided you with comment on whether or not a 5% discount is enough of an attraction tool to assist in your program with the specifics that you have for the county. Those are the three questions that came from us and it came out of the feasibility study that we had a chance to review yesterday. What I would leave you with is this, that whether or not you move forward with a program like this or not, and it fits within your risk portfolio, the suggestion that we would have, the advice that Edison would provide you, is that by evidence of an article that ran just this last week regarding a Visalia Mall, who saved significant amounts of money by going through in a working partnership with their investor-owned utility on energy efficiency changes, investment that they made, and the kind of savings they're going to see based upon their energy efficiency investment is substantial. And as we know, whether you're pricing a commodity in a program like this or you're taking traditional service, the cheapest kilowatt hour is the kilowatt hour that you don't use. And so whether you enter this program or not, what I would request, and actually I think would be valuable for both of us, is to engage in a very aggressive partnership on what opportunities are there, both for county facilities as well as for your constituents, for economic development purposes and others, on how you can best help customers reduce their energy costs through energy efficiency, demand response, and help people not use energy so they never have to pay for it, no matter who's providing it. So unless you have specific questions, those were our comments for today. I thank you again for having a chance to be with you.
Well, real quick, the feasibility study you're talking about, is that this piece that we just received? No. That's something else? That's this?
Actually, no, it begins with a letter addressed to Mr. Haddix, and it outlines what the feasibility study is. It's a very short addendum to the original feasibility study.
It's a 14-page document.
Thank you.
Okay. Mr. Delane, did you want to? Bill Delane, did you want to speak, or Mr. Wilson? Well, I just assumed this was the speaking section over here.
Row 2.
2A, 2B.
Chairman Conway, supervisors, Mr. Haddix, staff. I want to thank my colleagues for joining us here today and being able to engage in what I think is going to be a very meaningful conversation and hopefully be of assistance to the board as you continue your analysis and make a decision. Charlie Wilson offered up to you a few requests. Further, more detailed analysis. Please know that we're here to answer any question that you might have at any time. So thank you very much.
Thank you. Guess that puts me to row 3. Will you be speaking this morning? Okay. Anybody else in that section? That's it? Okay. Anybody else? Anywhere that would like to address the board? Okay, Mr. Orth, we're back to you, certainly.
Just make a couple of comments for the board to keep things in perspective. The risk-gain decision that was raised is absolutely right on point. And it's our intent to present back to each of the JPA members, should you become the 14th, you would join in what will become a very aggressive set of meetings through June, appear before each of the councils and present to them the risk-gain formula. There's a lot of questions that have yet to be answered. We're working with them. A lot of those are answered through negotiations with Citigroup, and we intend to have those deals or those negotiations completed in time that you can see that. Secondly, with respect to the rate-setting question, I think it's a valid one, but it may be a little bit premature to have the utilities assist you in evaluating rate-setting decisions when the authority board has yet to implement its rate-setting formula. It's important to recognize that as a member of the authority, you've given the authority board the power to set rates for your customers. And the authority board's general formula is a 5% discount for every rate class, every tier within every rate class, so that we can, as effectively as possible, distribute the benefits of the program. And then finally, the economic development question, again, I would point your attention to the Navigant feasibility study, which points out $13.8 million of potential savings for your region in a 3-year period. And if you apply that to an economic multiplier, which 3 times is a general rule of thumb, you're looking at over $40 million for the region in 3 years. So I would kind of respond, is there really a question of whether or not that provides economic benefit? Thank you.
I had a question.
Questions?
I had a question.
Yes.
How many households do you project that your plant will supply?
I'm not real good on the conversion for a 500-megawatt facility. It's 500,000 homes. It's 1,000 residents per megawatt, so 500,000 homes.
Ready for some board discussion?
Yes, I'm sorry. I'm making notes.
Well, a couple things. One is that the whole issue of risk is very critical to this. But one of the things I find very intriguing about this is that the greatest risk is being undertaken by the Conservation District. They're the ones that are putting up the bond money to do this at their risk. I mean, one of the things I really thought when it came to us, I thought they were going to be saying, yeah, we're here to sell you something and we want you to join in on the risk. And they didn't ask that. They didn't say that. So there is a huge risk here being undertaken by the Conservation District. If they don't see that it's worthwhile, then they're not going to want to risk those dollars, I don't think. And that is, it's not often you get an opportunity to get involved in something like this where you have, in my mind, a very low risk. From the county's perspective, $7,000 and $20,000 feasibility study or whatever it was that we paid toward is a very, very small risk to become a part of this. Secondly, you know, utilities are classic in terms of being monopolies. This is an opportunity to provide an opportunity for people. You can stay, you can opt out. And I think that's going to be driven by the numbers. I mean, if I get my first bill and it's 5% over what PG&E's in, I'm opting out. Of course, everybody would too, so I don't think that's going to happen. But I think that is, you know, there is a certain risk for the ratepayer talking about these issues that we talked about this morning, where there's some unknowns, but those are going to have to be addressed. And you know, nothing ventured, nothing gained. I just see this. One of the things that struck me was that I looked at, I think it was PG&E presented the information last week or month, or whenever we had this last meeting about it, talking about the additional power that's been brought online. And what was brought online was, I forget, 700 megawatts, but the demand was greater than what was brought online. So it didn't give me an assurance. I mean, there is a need for this additional power. I guess that's my point. That what the Conservation District proposes to do, to bring on a line another 500 megawatts of power, is going to be very helpful to the system. And it is a system. You know, every power player depends upon everybody else to make the system work. And so I see that as a positive. The additional power is going to help to bring greater reliability. And we have a growing valley. We know that. And Edison's dealing with issues now of trying to, you know, redirect power to where it's needed and so forth. This problem is not going to go away. So I see this as being part of that solution of providing a new power source to our region. It brings opportunity for ratepayers as an option, as opposed to the standardized kind of monopoly system of you have one supplier and that's all. And the risk is, the greatest part of this risk is not being borne by us, it's being borne by another entity. So it's an opportunity to join up, and I think we should do it.
Thoughts? I'm not going to pretend to understand any of this. As far as constituents being aware of this decision-making process, I'm not sure that they are. The only feedback I got was from one particular. I'm not even sure he's my constituent. Just wants somebody to buy his renewable source power back. But I'm not his supervisor anymore, so I'm not sure if he also spoke with his supervisor.
There was a good piece in the paper, though, and there was a couple good pieces in the paper about this. There were. I mean, if I can.
I guess I'm just saying that I don't know if you had calls from constituents or anybody that's, you know.
Again, I didn't receive any phone calls on this. I usually like going into things with my eyes wide open. That's why I read everything. That's why I look at it all. And I'm trying to go into this with my eyes wide open. And it seems like when we hit about the June mark, that's when we're going to receive some of the information I've been looking for. And so it's like, you know, we've got to take this step in order to get the rest of the information. That's kind of what I'm feeling, that if we take this step, we get, you know, we can become a part of it, we get that 14% of the vote or whatever it is to make some of those critical decisions. I'd rather be making those decisions than having them made for me. So, I mean, again, it's hard going to this without my eyes wide open because we don't have all the answers I think we need, but we're being told that we'll have all those answers before we have to make any other commitments. Is that correct, Mr. Haddix?
That's a correct statement. More information will unfold as we work forward. The critical drop-dead date is for the authority, and correct me if I'm wrong, but for the San Joaquin Valley Power Authority by June 30 of 2007 to, I guess, bring Tulare County into the fold. Am I correct about that? Because after that, then the cost of joining goes from $7,000 to over $2 million because you're into a different year of fees. And so there's a time of which there's a fish or cut bait time, so to speak. If I could respond to another comment I also heard regarding renewables, I think it's the intent, as I understand it, the authority that they will be purchasing the power from within their district. Is that correct? Except for what you contract out with through Citigroup Energy, Inc. And maybe, Mr. Orth, you might also respond to, let's see, a statement that was made at the most recent board meeting about a desire to try to purchase renewables. Did I get that right from within the area?
Actually, the authority just last week, and my board as well, authorized the issuance of a request for proposals that went out into the market, a request for bid that went into the marketplace last Thursday for 400 megawatts of renewables with a priority given towards those projects that are built within the region. Again, if you think about and go back and look at the legislative intent under AB 117, it was to spur competition and to spur local investment in capacity. And so we took that seriously, and the authority's vision isn't just about building a baseload plant. That becomes kind of a cornerstone here for economic opportunity. But the big picture is to create a mechanism where we can spur more investments in local renewables to deal with our waste management and our air quality issues. Now, we will be buying renewables from areas outside of the valley in the interim, and most likely in the long term there will still be some incremental purchases from out-of-valley sources. But we truly believe that the intent here is to create a regional collaborative program to spur local investments in energy facilities.
Oh, you know what? I do have one question. And gosh, I just hate it when I don't understand something I'm asking a question about, but I'm going to say this anyway. And if you've already explained it, then just say. In speaking about the forecast or making, cost analysis or any of those things, does that change whether we're in or not? It would. I mean, if we say yes, would it be one number? If we say no?
In terms of the cost of program implementation?
Yes.
Let me try to answer that, because I'm not sure I understand completely the question.
Well, I asked the question. I'm not sure I understand the question. So
the program economic objectives can be met with or without Tulare County. Okay. The interest in the authority board in bringing you along is that there are some potential economies of scale that are added by having 60,000 more customers and another 1,000 annual gigawatt hours of service. But the program objectives can be met without you, if that answers your question.
that's somewhat helpful, yes.
Okay.
Just clearing this up. I don't think you can help that, but thank you.
Now, we don't have to guarantee so many people, right? In other words, if we sign up on this, we don't have to guarantee you such and such.
No.
It's any amount of people.
There's not a requirement here in the agreements that you will execute with the authority, which will be in front of you in June to consider, to identify those risks and commitments that you're making. Do not contemplate that you're going to guarantee a minimal amount of load. If 95% of your customers opt out, you'll have a decision as to whether or not you want to continue to extend the service to a small percentage of your region. That reality exists, but it's not a commitment.
Okay, thank you.
Okay. Any more questions? Any more deliberation?
Madam Chairman?
Like the two in the middle and Supervisor Ennis, you and I are kind of saying, huh? Yes, Supervisor Worthley.
Well, I'm going to move that we approve items 1 through 4 with the modification that should be subsection S.
Actually, let me interrupt just a second. Actually, you're only going to want to approve items 1 and 2,
right.
3, 4, and 5. 3 is for next week, is for the next meeting.
Yeah, I didn't include that.
So it's 1 through 4.
1 through 4. I didn't include 5.
Okay.
Actually, the payment needs to be included in this week's agenda.
No. Yeah, I'm sorry. Maybe excuse me, Supervisor. Mr. Orth, did you state that there would not be a problem if the board took up the payment of $7,000 at its next board meeting, which is 2 weeks out from today? Okay, because otherwise, Supervisor, there's an issue.
It would be an urgency issue.
Okay.
So my motion was items 1 through 4. Did not include the finance.
Yes, but you see, item 3 is the waive the second reading and adopt the ordinance. That's to be taken on May 1st.
Well, I'm looking at my thing here. It looks a little different. Okay. We're going to introduce and waive the first reading of uncodified ordinance. That's my number 1.
Right. And number 2 is approve.
Approve the ordinance summary.
Right. And direct the clerk to
Publish. And there's a correction on the first one there, too. Item 3 is to waive the second reading and adopt the ordinance.
And that's on May 1st, that you're going to do that on May 1st.
Okay, so we don't take action on that then today.
Right. And
Or set the manner for...
Or it's an option, you can either do it now or after you adopt the ordinance, which might make more sense.
Okay, so it should be 1, 2, and 4.
1, 2.
Well, what about
1, 2.
4?
You can do 4, too.
Yeah.
Okay.
I
I'm
can
sorry.
do 1, 2, and 4?
Yeah.
Okay, let's do the 1, 2,
Let's do that.
It's like ordering lunch.
Anybody else
Now you have to have a
have
second.
a combo they'd like to offer?
Now you need a second.
Oh, my goodness. Okay, Supervisor, I will be serious now and get back to you one more time. That is 1, 2, and 4 you're suggesting? Okay. You have a motion?
That was my motion.
I'll second,
I have a motion and a second.
knowing that we're going to come back at June for the final analysis.
Cast your votes. Okay, motion passes. 1, 2, and 4, and we'll be back. May 1st, we'll be back. Thank you all.
Public comment.
Public comment, yes, thank you all. I'm forgetting where I'm at. R2 item, just want to be official here. Item 26, which is public comment. Anybody wishing to address the board of items, on items under our purview but not on the agenda? Now would be the appropriate time.
Thank you, Madam Chairman and the Board of Supervisors. My name is Martin Youngsma. I'm from Salem, Oregon. And what brings me here is several articles that were referred to. You talked about, well, there's some good articles in the paper. I represent a recycle company out of Oregon, which is a pilot model for the Washington, D.C., actually, in sustainability. In coming down here, I was brought to the attention of several articles, one in the Visalia Times Delta, which referred to a grant given to a foreign company here to recycle. I looked at the pictures. I also made a visit out here to your local site that you apparently have rented to them, and examined some of the product that was brought out there. The articles referred to several hundred tons of product coming from the dairies, and my name is Martin Youngsma, which ought to bring some attention. That isn't Irish. I'm related to lots of people in your county. I grew up in the state of California, very Dutch. So anyway, I went out and looked at it, and there is not a very impressive amount of material out there. If there's 10,000 or 20,000 pounds out there, I'd be surprised, rather than several thousand tons, okay? I commend Visalia County for pursuing this recycle material. It's very, very important. But at the same token, my big question was, well, what's wrong with these pictures? The pictures do not represent what is here, okay? The other thing that really concerned me, because of the fact that my nephew actually owns a company up in Oregon, we recycle millions of pounds. We're a pilot study for DC feasibility of how to run a recycle company and make money at it. They've done it for 15 years. In the article here, they talk about 3.8 million investment, with 1.575 million obtained through the Economic Development Block Grant through Tulare County. In explaining to you what we currently have done, we have worked with a fellow by the name of Jim Taylor here in Tulare County for the last 2 years. He has provided us with inaccurate numbers. I didn't pull the accurate numbers, but I'm guessing we do somewhere in the neighborhood of 2.5 million pounds, okay, a year over the past 2 years, okay. Nobody has contacted him or talked to him. He could really use some help. I listened to Madam Chair about what this is all about as far as tax money and what happens in our communities, and I just couldn't help but say, I need to come talk to somebody. And he said, well, I happened to find out you folks were meeting today, and I thought, well, if I have the opportunity, I'd love to come visit with you and talk just a little bit about this. One of the reasons I came down was one of our grandsons is now went back into the Marine Corps. You're probably familiar with his brother, which passed away in Iraq in December. His other brother is also in the Marine Corps. Okay, I stood there at length and noticed, couldn't help but notice all the sayings and all the criteria that the Marine Corps has up there. And when she brought up the fact, one for all and all for one, that's what this is all about. Okay, so if we're going to help somebody, we're going to do something. Let's start helping our own. We do not need to help a foreign country that hasn't proved their point and grant them in excess of $1 million and leave our own sitting out here that's done a terrific job and is currently doing it and can supply real numbers, not some far-fetched projection. And this is really all I came to say, and I wanted to get bring your attention to this fact. Jim is here with me. If there's any questions I can answer, we'll be more than happy. And if there's any numbers or anything that you folks would appreciate getting, we'll supply them.
Thank you, Mr.
Thank you
Councilman.
so much.
Thank you very much.
I was going to say, you might refer to Mr. Hayter at RMA.
Probably.
Bill Hayter at RMA would be a person for you to contact, sir, if you have the time while you're here.
Okay.
Because he was sort of I won't say the architect, but the conduit, if you will, for the proposal that you're looking at right now.
Okay, and I wasn't aware whether or not this was the proper place to go, but I did find out that you folks were meeting, and you are the supervisors. And I said, if I get the chance to talk, I'd love, and I admire what you're doing. I sat here and listened to some of your problems, and I'll tell you, they're not easy ones. And you folks have done a great job.
We appreciate you being here, and as Supervisor Worthley just said, and I'm not sure if you heard him, that you're a very patient man to have sat through our meeting. But right outside at the window there is our staff that will be able to give you, so that you have the right spelling of Mr. Hayter that Supervisor Worthley is referring you to, and a phone number and contact information for him is with our Resource Management Agency.
Okay, I will be happy to do that, and thank you so much.
Great, thank you, Mr. Jensman. For a minute, I thought you were Irish, but then you cleared it up for me. I appreciate that. Okay, item 27, Board of Supervisor matters. As if this morning's weren't enough, Supervisor Ennis, do you have Board of Supervisors?
Well, the only matter I got this morning is I just wanted to wish Phil Cox a happy birthday because it's his and I's birthday today.
Oh, my goodness.
On the same day, and that's amazing.
Same year, too, isn't it?
He was in high school when I was born.
Yeah, that's what he said. He was in high school.
You're both 39 years old, I know.
That's all I've got to say.
Well, happy birthday to both of you.
Thank you.
I don't think I have anything else to say. I've said enough today.
You're done for the day?
We have a student from COS here today who I interviewed with briefly. Want to welcome her here, and you have a lot of patience as well. I hope you were able to follow everything that happened. Good to have you here.
Thank you for being here. If this was any insight into the world of county business, let us know.
She's going to stay far away now.
We didn't mean to scare you off. Oh, you're in the health field, okay. Well, thank you. The only other item I have is, and I think I talked about this last week, is that it is the San Joaquin Valley Regional Supervisors Association Spring Conference, which we are hosting, so that will be starting tomorrow evening and conclude on Friday morning. I want to thank all the staff members that have actually made that happen. It was when we say we're the hosts, that's easy to say, and we will be running the meetings, but it took a lot of time and effort on our staff's behalf to make this conference happen. So I want to recognize each and every member of the staff that contributed to making this regional meeting a reality. And with that, council, we have need for closed session.
We do have need for closed session. They're listed on your agenda. We will not need item A, and I should comment on item D that County Counsel's Office has represented the departments in this matter. It is an employee discipline dismissal case, therefore we will not be, we have not advised the board and we will not be participating in your closed session on that today, but the county administrative officer will be able to report out on that depending on what your action is. So otherwise, we have items B through G, and there will be no other report outs except item D if you all take action.
Okay. Item D, if there is action. All right. Thank you. Closing this part, going to closed session. Far too much paper. Sort through all of it. See what goes where.
Yes, he will probably have a report.